who are going to opportunities to partner, see opportunities to work together, leaders who can see opportunities to amplify the work of others without feeling as if there is competition. People who can communicate mental health issues, the policies that need to be put in place, the measures that have not been put in a way that can be actionable, and in a way that the government and other civil society organizations can appreciate, therefore utilize that social capital that they have with exemplary leaders to even now put this into programming. The other, what I wanted to also speak about is we want to bring out the best in programming for mental health. I think it should be an initiative on its own, and that we want to bring the intersectionality of mental health, cutting across from sexual and reproductive health to climate change, to employability, to government, to private sector, to health, to everything. We must create ways that mental health can be programmable, because then if it cannot be programmable, then you will not see it in results. You will not see it in work plans. You will not see it in presentations. And therefore, people will continue to neglect it. But the moment you make it an influential topic, that people, something that they cannot forget, then you have an opportunity to grow. As in the adolescents and youth and sexual and reproductive health, I've always prioritized mental health. We know that girls and women require mental health during their menstruation. Survivors of FGM, survivors of gender-based violence have to be, we have to program mental health for them, because it's a priority need. And also, even young people at adolescent age, that they are, they're starting to grow, they're starting to expand, they're starting to change. There is a mental health component that is incorporated there, and that if we
Leshan,
an opportunity.
Leshan, thank you. Thank you very much. Just because of time, maybe I would like to cut you short there, but I'm hoping that we'll be able to give you another opportunity to continue sharing your very important points. I've been able to capture some very good points about what partnerships means, the importance, the benefits, that you're able to reach a wider, you have a wider reach, you're stronger in terms of your advocacy, and the need to have exemplary leaders or vote for exemplary leaders, the need to also train adolescents and youth on advocacy and activism so that we can meaningfully involve them, and the importance of understanding intersectionality and integration of mental health also into other programs. So to our audience also, I believe you're getting very good points from our speakers. If you have any questions, any comments, please keep typing them in the chat box and we will come back to them. And our speakers also keep checking on the chat box and respond to the chats that you can. So thank you very much, Leshan, and hopefully we'll come back at a later point. At this point, I would like to move to Mlewa Kalama. Mlewa, kindly introduce yourself further and take us through the strategies that can be implemented to break down or penetrate cultural and societal barriers that may prevent open discussions about SRH and mental wellness among adolescents and youth in conservative settings. So welcome, Mr. Kalama.
Thank you very much.
And maybe I'll specify the time you have. Let me specify that you have about 5 minutes, yeah? Sorry, Leshan, maybe I didn't do that before you started.
Thank you, Maria. That's good to know, so that I know how long I'm going to speak. Onesmus Mlewa is my name, as I've been introduced, and I work for YINASO. And I'm really happy to be part of this conversation. YINASO is a regional network that works across West, East, and Southern Africa, and mainly on Anglophone Africa countries. And we do quite a lot of information dissemination, development of community guides, strengthen the capacity of communities to engage effectively in health-related matters. of matters SRHR. I think this is one of the extremely emotive subjects, especially when we are talking of SRHR and targeting adolescents that matter. And I think it's high time. I think one of the best strategy, like I have been asked to talk about, is adopt a realism approach. I think for a long time, what actually has been happening is we've been burying our heads in the sand and actually assuming or pretending that things are not happening. And it's what we call a parent approach or a father approach, that no father or no mother wants to even assume or even think that their 14-year-old girl could already be sexually active. And people normally hide behind this ignorance that it shouldn't be. But reality speaks different. And the statistics are telling us a totally different story. The sexual debut is actually coming lower and lower every other single day. I mean, we are having young girls as early as 10 years, 9 years, 11 years, already sexually active. So this is the reality on the ground. And that means our cultures needs to be tied up to the realities. We have really tried to look at the issue of culture in its broad sense. And we are saying, well, what exactly is this culture we're talking about? It seems to be a word that is used selectively to fit certain purposes and certain situations, which basically I think shouldn't be the case, because cultures evolve. When we were growing up, I mean, some of us who have been there for quite a while, our cultures demanded that young girls and young boys would sit with either boys with their grandfathers and girls with their grandmothers, and they would culture in a way of life. They would be told what to do and what not to do. That was culturally appropriate at a particular time. Today, we have moved so much into nuclear families, and actually there is no time or even room for young girls and young boys to sit with their grandfathers or grandmothers. Some of them don't even know who their grandfathers and grandmothers are. And the culture has actually evolved. We are actually in a digital culture now, where adolescents are exposed to all forms of information through the digital media. So when we are talking about culture and how do we break into cultural perspective to start actually profiling the importance of SRHR education, information, and communication to our adolescents, comprehensive sexuality education, to ensure that our girls and boys have the right age-specific information that will help them make rational decisions, we need to put the issue of culture into perspective, understand and agree that cultures change, cultures evolve, and we are actually in a digital culture era now, and we need to approach matters in that perspective. So I think one of the key strategies should be to basically championing both adolescents and community gatekeepers to actually move with time and understand that we're actually in a different time now. Let's champion our decision makers and those who are actually responsible to make laws in our countries, so that our decisions, our laws are actually in conformity with the current cultural changing dynamics, because that is the only way we can actually be able to ensure the new generation actually finds its space to enable them actually maneuver and move in a space that they can actually be able to access commodities and services without fear of stigmatization or reprieve from a cultural perspective that actually is not in tandem with the current times. So let's champion leaders, let's champion communities, let's champion young girls and young boys to be able to actually understand the changing times and actually what needs to be done in community, so that we can actually have an informed society that is able to rise to the challenges of the day. Thank you.
Thank you very much,
Over to you, Maria.
Yeah, thank you very much, Onesmus, for that very enlightening session. You've touched on cultural practices which probably were supportive of passing SRH information and are currently not available. So what do we need to do to make sure that we are responding to the adolescents' needs in this current era? And you've given some suggestions. I welcome our audience to keep typing in the chat also about what more can be done. You've spoken on a lot of issues, and we will come back to you again later so that you can continue enlightening us or expounding, and we will also have a Q&A session. So I encourage our audience, draft your questions, put them in the chat or have them ready so that at some point we give you an opportunity to share. So some of the speakers we had planned for are having technical challenges with joining or being able to participate. So at this point, I would like to go back to Leshan again and give Leshan an opportunity to expound on a very important topic that he had started on, intersectionality of mental health issues with all other SRH issues. And Leshan, before I interrupted you, you were talking about, was it on menstrual health issues and mental health? Please come up and continue with that line of intersectionality. Thank you. Leshan, I believe you're still with us. Leshan? Okay, as we wait for Leshan, maybe I can give an opportunity to a member of the audience or participants to make a comment on any of the two speakers' presentations, whether it's okay. Lizzie Otaya, welcome.
Thank you, Maria. Thank you for moderating. And it's good just to hear when we're talking about SRH and getting it from the male side's voice, and they're calling out for adult.
We seem to have lost Lizzie.
Can you hear me?
Okay, please start again. I'm not sure if it's just on my side, but at some point I couldn't hear you.
My apologies. It could be my connection. So just directly to the question, back to the Onesimus, we're talking about culture and just accepting the fact that it's dynamic and it keeps on changing. But when we talk about having laws and having, policies in place that support access to sexual reproductive health services and commodities, we're addressing government officials who are still, how do I put it? They're still old, so to speak, and their mentality is not hip or hyped, like they do not accept digital spaces and digital revolution. How do we address having an old mindset that accepts old culture and try and, get a mental shift from them? How can we go around that kind of an issue, especially within the government?
Yeah, thank you, Lizzie. And you're extremely right. Most of our policymakers and decision makers, unfortunately or fortunately, are in the older age bracket, and they still think, look at perspectives of themselves when they were young. When you talk about youth, they always want to reflect back on their own youth, and they'll tell you, no, this is not our culture, this is not how we have lived. But like I said, I think what we need to do is to start championing them now to reality. I started talking about realism. The reality on the ground is different, and it's not like they do not see, they see these things. And where it actually serves, sometimes it helps to actually take these people out of their comfortable chairs in parliament or in their offices and probably give them a ride or a field visit and see what actually is happening. Some of them, trust me, have actually not even gone into a nightlife or in Lusaka, and they really don't know. They just go to the offices and come back home every day, and they think everything is that quiet. Give these people a ride. Take them around, let them see how the culture has actually changed, and tell them that this is the reality on the ground. For you to simply get stuck to the old ways of doing things is actually hurting an entire generation. So it's time to really culture our decision makers who are still holding on to the old reins, that things have changed. We are into the digital space now. Some of them actually give their phones to their daughters to say, hey, can you look for me something here. They don't even know how to use it yet. Their daughters and their boys are just techno service. They can get into every site, into everything that they want to get into those ones. So I think these are the things that our decision makers need to understand, that time has changed, things have changed, and things have to be approached differently. Thank you.
Thank you very much, Lizzie and Onesmus. And June, I see your comment there. You're agreeing with Mr. Mlewa. Many of the youth, more so girls, don't get to have such talks with their parents or guardians, and they end up turning to the media and peers. I'm glad I had the conversation with my younger sister, and I still do. So yes, we are having, the approach of siblings talking to one another about SRH, which is also a positive thing. And we are challenging guardians, parents to also open up and be free with their adolescents and youth. We have another hand raised. Ibrahim Joseph, welcome. Ibrahim, you can unmute yourself. Ibrahim, can you hear me? Okay, seems Ibrahim is not able to speak at the moment. Okay, somebody unmute Ibrahim. It's like he's trying, but from his side, he's unable to. Collins or somebody, kindly unmute Ibrahim Joseph. He's saying he's not able to unmute himself. Okay, Leshan, are you back? Our other speaker, Leshan, we were interested in still hearing from you. Collins, can you hear me?
But we can hear you. So I think maybe it could be
Okay,
from the
thank you.
organizer side.
Thank you, Lizzie. Okay, to our audience, anybody else with a question, maybe you can type it on the chat as we wait for the organizers to sort out the issue of unmuting. Okay, if not, personally, I can take you on a bit of a...
Hi, Mary.
Yes.
Ibrahim is able to unmute himself. Ibrahim, just unmute yourself and speak, please. Thank you. Seems he's having some challenge. Please just go ahead with the next delegate.
Okay. Okay. Since our other speakers were not able to join, or are they now able to join?
No, the entire team was coming from Nairobi County, and they have.
Okay. Leshan seems to also not be with us at the moment. Or Leshan, are you there? Leshan?
He has dropped as well.
Okay, so if not, I'll also just take this opportunity to speak a bit more about adolescent and youth SRH. I know during the pre-conference, Dan, my presentation had spoken about this, but probably not everybody who was there is here today. And so just to speak more about mental health, mental disorders among adolescents can have short and long-term health and social consequences. And poor mental health during adolescence is associated with higher substance use, early pregnancy, dropping out of school, and risk-taking behaviors, as well as depression that can disable the adolescent or the youth. And that's why it is important that we should address mental health as we are addressing SRH. As somebody had mentioned, the needs of adolescents are diverse. We have the teen mothers, those with disabilities, those living with HIV, other chronic diseases. As we intervene, we should remember there are those who are in school, others are out of school, migrants, refugees. And we need to apply complementary strategies through various platforms. And that's why we had wanted somebody to speak on digital health, but they were not able to join us. So we need to use different platforms so that we can be able to reach a wide population of the adolescents. We know that adolescents and youth are mainly techno-savvy nowadays, and you will find them on social media platforms, and that is the best platform probably that we can use to reach a huge number of the adolescents. But there are also those who are deep in the rural and remote areas who are not able to access technology. And for Faith to Action, we talk of also working with religious leaders, because you'll find that adolescents and youth go to places of worship, and who better to pass the message than a religious leader? And if they've been capacitated, be sure that they're able to do that. We need to offer information on SRH and mental health and well-being services, and where they can access them, even before in advance, so that we are not reacting. I think most of the time what we have been doing is reacting. We wait for problems to occur, and then we start solving them in a reactionary manner. So we need to be proactive when it comes to supporting adolescents with SRH or adolescent SRH and mental health needs. So I'll share a few lessons learned from our work at Faith to Action Network together with our partners. So in Southern Africa, what we did was to work with faith-based actors across various Southern Africa countries to integrate SRHR and mental health information provision into church programs or faith-based programs. So whenever they have youth conferences, meetings with women groups, meeting with men groups, this matter of adolescent SRHR is discussed. Then in Kenya, there's a project we did for faith and SRHR in West Pokot. And the strategy we used was to work with the community members. So we had talked about partnerships before. So working with the community members, we did this through an organization called World Vision. I'm sure many of you are familiar with World Vision, who are good in working with community through faith-based approaches. We worked with schools through an organization called DSW, and then we worked with faith actors or religious institutions as Faith to Action Network. So through this partnership, we were able to capacity build community members, faith leaders, teachers, and adolescents in schools. You can imagine the impact now when it came to achieving the outcomes of the project. Then we have a current project called Solutions for Supporting Healthy Adolescents and Rights Protection, which is ongoing currently across 6 countries in Africa. And we are promoting SRH by improving both the supply side of SRH and increasing demand through convincing religious and sociocultural interventions, some of which Mr. Mlewa has mentioned. So what are the lessons we've learned when it comes to Now increasing access to ASRH as well as mental health services and programs. So there's the importance of recognizing faith actors. As I had mentioned before, sometimes faith actors are mistaken for opposition. And yet it might just be an individual religious leader's perspectives who is quite uninformed or still burying their head in the sand. But if we recognize them even when designing programs and work with them, we can be sure of having a higher success of a higher buy-in and increased chances of success with the project objectives. And when working with religious leaders, we need to capacity build them. So you'll not just call a religious leader and start talking about SRH without providing some evidence, discussing about some technical terms and what they mean, and availing for them also information that they can use to understand more about SRH and even how they'll be able to speak about it. So we need to engage and capacity strengthen religious leaders. Then of course, youth leadership. So I'm sure for all who are here, we are the converted. We agree that when afforded the opportunity, adolescents and youth can be innovative and creative in their approach to addressing SRHR. So the faith community, as well as even non-faith communities, are increasingly willing to be led by young people. They are taking time to listen to young people through the approach of intergenerational partnerships. And I can say that maybe at the moment, we are doing better when it comes to allowing youth to take lead on SRH and probably mental health issues. I'm not sure where we are with mental health, but through this convention or through this conference, we are getting more information on how and the importance of integrating mental health or mental well-being into SRH programming. Then peer learning approach, which is very impactful. When we create awareness and build the knowledge of adolescents on SRH and mental health, their confidence improves and their ability to influence their peers positively on matters SRH is also utilized. I think from one of the comments there, we saw that somebody was saying that they've been able to speak to their younger sister. So this shows that even the peer-to-peer approach works, yeah? And from a project I mentioned that we implemented in West Pokot, the teachers and school heads reported improved positive interactions among peers and improved discipline, as well as academic performance after they had been trained or sensitized more on SRH and mental well-being. So you can see that the impact is not limited to SRH and health only. It also impacts on their overall discipline and academic performance. Multi-stakeholder approach is another lesson learned. We collaborate as partners, and as Leshan had mentioned, the different partners come with different capabilities, so there is no unhealthy competition. You can leverage on one another's competencies, leverage on resources. You have a wider reach. Some are able to reach the faith leaders or faith communities. Others are able to reach schools better. Others are able to reach even cultural leaders better. So the multi-stakeholder approach is something that we need to promote when working on SRH and mental health. And without leaving behind the youth-led organizations and adolescent champions. Because all this, yes?
Sorry for interruption. Mkabana is joining in a minute.
Pardon?
Mkabana, one of the panelists
Yes.
from every county, is joining in a minute.
Okay, thank you. So I was even done as I was now on multi-stakeholder approach, that we need to include everybody as all these different stakeholders have a role to play. And through the joint efforts, we can be able to overcome any barriers that we will face when addressing SRH and mental health issues. Thank you very much. Let me see if there are more questions. And once our speaker is ready, kindly alert me. Thank you. Any questions from our audience? Rosalind Mukabana, are you here? Are you ready?
Just give a minute, please.
Okay. Onesimus, maybe there's another light bulb that has gone off in your head. There's something you might want to add at this point.
Yeah, I think just to add on to what you have said, everything the buck stops on the kind of policies that we actually have that guide our operations. So yes, we can talk cultural perspectives, we can talk different operating environments, we can talk challenging times, but I think we have that there is a very strong place in our making process that can actually really provide a very big green light for increased access to services, especially for adolescents. If you look at, we have done a mapping of the different policies in the East African partner states, and we know where the gaps actually really lie. There is a very huge disconnect, especially when it comes into the policy frameworks and documents that lie within our countries. While most of the East African community or African constitutions actually provide for free and quality health care for everybody in their respective countries, when it comes into operationalizing this constitution, then things actually change. You find that you have subsequent legislations that are actually put that contradict this fundamental constitution, and that actually really does not allow for free access of ease of access of SRHR commodities and services for specific groups of people. And when we are talking about the adolescents, then there are always issues of informed consent. I mean, while yes, we need to actually be protective of our adolescents, I think I will keep on referring to the realities on the ground. I mean, this should not be a gateway to actually denying adolescent SRHR services that are actually age specific. So I think we have a very strong need to ensure that our laws are actually better aligned. Our policies actually provide for privacy, provide for increased access of SRHR services for everybody who actually needs them in a manner that actually guarantees safety, so that we can actually avoid some of the misgivings that are happening in our community today. We have so much ills like safe abortions happening, and these are happening because those who actually end up procuring unsafe abortion have no green light of where to actually access these services, because either the policy environment is too restrictive and criminalizing of such acts, that they end up actually in the back streets procuring unsafe abortions. And we have lost so many of our girls, and so many of lives have been lost simply because our policy is not actually in conforming with what is actually happening on the ground. So I think we have a very strong need to ensure that our policies are aligned to actually allow for the provision of services for everybody, as it is outlined in many constitutions of our partner states. Thank you.
Thank you very much, Onesimus, for those enlightening words about policies. And it is our responsibility to push for supportive policies and even implementation. Sometimes we have the policies, but implementation is the problem. So we should all take it upon ourselves to hold our leaders accountable, to develop supportive policies and also to implement the same. Thank you very much. Is Mukabana now ready? Rosalind Mukabana, are you there?
Yes, I'm here. Apologies for that.
Okay, thank you very much. You're welcome. We're happy to have you at this point. So we'll allow you to introduce yourself and maybe share with us some of the challenges faced in providing gender-based violence services to adolescents and youth populations in Africa, and how we can ensure that these services are accessible and effective in promoting mental health. Welcome, Roslyn.
Thank you very much. Good afternoon, everyone. Apologies for joining in late. I had some technical challenges. As you've been told, I'm Roslyn Mkabana. I work for the Nairobi County government as the Chief Medical Social Worker in charge of psychosocial issues. And I'm also the head of the gender-based violence unit within the Nairobi County. Yes, we have a lot of challenges for our youth, because when we look at the 4 domains that actually are supposed to support the well-being of our adolescents, that is agency and resilience, we do get some of the agencies and even our non-state actors or state actors not being very friendly to our youth and adolescents. When we look at community and connectedness, we also find that even within the community itself, the patriarchy way of society bringing up some of us makes it very difficult for us to report even to our own families when a violation has occurred. And then when we go to the education, it's been a challenge, I know, and I'll talk about Kenya here, that is our own country. After the ruling on what happened within the ruling for the Supreme Court on matters LGBTQ, there's been a lot of backlash for students within our schools that they are being suspected of either being LGBTQI and thus being sent home and then not being able to also talk to their parents about it. And the school insisting that they need them to go to a counseling space. But when they go back to the school asks, why aren't you accepting that you are this? That is a form of violation, again, that is being undertaken. And we see it in both ways. The school itself is perpetuating violence against the student by not allowing the student to be able to tell what is the truth, and the student herself not being able to justify that I am not part of it becomes also a challenge, and then it brings a problem. So when it comes to reporting, then we also need to work with organizations, starting from the employment, from the schools that I've also said. We need to have schools that are allowing space for children or adolescents to be able to report issues of violations. We need to have our teachers who should also be on board on how to identify and respond immediately. And then we need to also have another domain that is safety and support. How are we enhancing this within our various spaces? And then, of course, the matter of good health and nutrition, where we are also bringing in the issue on mental health. So the biggest challenge that we are facing among the youth is the violation. When it happens, they are scared. Maybe they know the perpetrators, and especially the adolescent. It's very rare to just get an incident, a one-sided incident, where an adolescent does not know who the perpetrator is. Mostly, again, we are having high numbers of incest among the homes. And remember when we had COVID, the highest number of defilement cases that we had and rape were actually occurring at home. So now, when it comes to reporting such a perpetrator who might be who is a close relative, and then not the family, all the family members will be for it. So then it makes it difficult for these adolescents to go and report. For those who eventually even appear to seek these services, most probably they'll even come in after the 72-hour period, whereby the provision of the minimum package of care becomes a challenge, and thus brings the issue of communicable diseases. That's where we are, the issues of transmission of diseases like HIV and teen pregnancies. And then when we have the teen pregnancies, for them, again, to keep that pregnancy, knowing that it has come from an incest relationship, they might not want to keep it, but they're forced to do so. Thus, encouraging what we are having a lot of mental health issues to some of the young girls undergoing this. We cannot leave out matters of self-blame and blaming about the assault. Had I not done this, I would not have been defiled, or I would not have been beaten, or it's my mistake that this person did this to me. I should have been home early. I should have dressed in a certain way. So the issue of self-blame, shaming themselves, and then sometimes also, as the previous speaker has just alluded to, not being able to know where these services can be found. And then, of course, coming to the services themselves, there is the issue of them. Our service providers, some of them are not very friendly, and again, will start shaming the person who has come to bring the result, to come and talk about what has happened. And they feel that they are being stigmatized within the facilities. And some of our health facilities also, we need to also see, are our healthcare providers or our service providers, ranging from the whole continuum of care, from the beginning of when you report within the community, starting from if it's a matter reported within the community, how has it been received by either your community? How has the hospital or wherever facility you've gone to received you? If it is matters of linkages, how have you been linked? If it is to go to the police to report after you have been seen, what is the reception at the police? How did they face it to you? And then when it comes to, again, matters on judicial, when it comes to going to court, how friendly are our courts to our young people when they're coming to be taken to court on matter, to go to court to give evidence on matters of especially sexual violence? How friendly are our courts? How friendly are our judicial officers? So when we look at all these things, we realize that our youth have a problem in terms of being able to report. But again, we cannot just leave it at that point. And that's why it is important for us to see what is it that our young people would want when it comes to matters of GBV and reporting. Because we need to have what we are calling safe spaces for developing and just being able to just express that personal identity as an adolescent or as a youth, which is very crucial. Looking at a support network of both parents, peers, and teachers, so that it gives room for an adolescent's mental health and behavior to be able to just provide a lifelong benefit, even after having undergone an ordeal. And then even for us as state and non-state actors, how have we invested in our education in terms of ensuring that as we talk about some of us children who have dropped out of school, or children who are working, or the marriage in quotes of adolescent, or those who do not find themselves in the mainstream education system, where are we at? Because these are some of the things that contribute a lot in terms of feeling that they are not part and parcel of the system to support them to be able to report on matters of sexual and gender-based violence. Are we also looking at how friendly are our spaces as we provide this? And this is how I think about how do we go then to ensure that this happens? We need to demonstrate that there's technical competence, like in terms of timely linkages to specialists. They come to our facilities, and from the gate man, how is this gate man receiving them? And that is why we are looking at, initially we have had what we call the standalone SGBV facilities. But what that has created is to stigmatize a lot. So we need to move from standalone and have integrated SGBV services at all levels of facilities. Unless it's not possible, then the healthcare provider or the service provider at within any level should be able to refer appropriately and with all the confidentiality that that referral pathway entails. Let us look at how we are empathizing and concerned about looking after this adolescent or young person, and also suspend our judgment and our socialization in terms of looking at how sexual violence occurred at that time, and see the person, look at that person in a humane manner, and not see the problem that has presented that particular survivor to our facilities. How accessible are our services? In the event that they come, do we have signs to show that that is a sexual and gender-based violence clinic? Do we have a way, the same way that when HIV started, there was a lot of stigma in attending the HIV clinic until the comprehensive care clinics came about. And so for us, even in Nairobi County, we have come up with a name, and we've given all our SGBV integrated services, we call them Tumaini clinics, to provide that dignity and hope for a survivor when you come there. And that entails that we had to do a training from starting from the gate person to that person who is in the kitchen, to that subordinate staff sweeping, to understand how it is important to be able to provide the empathy that this survivor of sexual and gender-based violence requires. Do we have spaces that are confidential and privacy to reduce the stigma? Yes, that is one of the things also that we need to ensure that happens. And then let us also just look at our practices. How context sensitive are they? And are they acceptable to the community? Because I remember even when we do coming up with safe spaces for survivors of sexual violence, when we need to remove them from the environment where the perpetrator is, and we take them there, how acceptable are these safe spaces? Did we do a public participation? Because we noted in one county where this safe space was done, and the community does not understand why a survivor must leave their home to go and live in that safe space. So what is our awareness rate in creating this awareness to people to know that in the event of a violation, you can be able to be put in a safe space. This is the toll-free number that you need to call, or this is the person that you need to get in touch with. Again, to have SDBV focal persons within our counties and our sub-counties that are able to be reached out to and provide these services. And then also, even as we look at our universities and all, have we created and allowed our adolescents themselves to give us the reasons why they don't visit our facilities, to allow them the space to come up with their own context-specific ways in how they would want us to be able to provide these services. And also, how have we linked, because the issue of mental health is very fundamental. I know one of my colleagues yesterday talked about issues of mental health, but how do we link them again and ensure, other than our adolescent survivors, young persons coming for the services, that the young person can be able to continue with mental health services within the same facility after being given the minimum package of care? Because we say we want to provide the fundamental minimum package of care, which includes counseling. But after they have come back and have been given either ECP and PEP and all that, do we ensure that we do a good follow-up so that then we do not end up with cases of suicidal among our adolescent and young persons? Do we talk, and then we also need to be able to let them know as they come in to be given the services that this is the type of package we'll give you. We shall expect you to come this, and then take it upon ourselves as service providers to call back and ask them how they are doing, so that it does not look like they're carrying that burden on their own. Unless there's something I've left out, I think for now that is how we need to work, and also just ensure that the integrated facilities are not only in specific levels of facilities, but they're at all our facilities. And also let's look at our toll-free lines. I know yesterday we had the data that was given, and the impressive thing, people might say there's a high number of SGBV cases, but let's look at it also in the other aspect, that the reporting rates have gone up because there's awareness creation. When we look at our data from January to April up to current, it's impressive to look that we have actually 67 men, and out of the 67 men who reported, we had about 45 of them between the age gap that we are discussing now. And they were able to come up and reach out and be able to be seen. But again, the challenge we are having with the men is that after the minimum package of care, the other sessions that remain, they are not willing to come back for fear of getting someone they might know, and also wanting to be seen in facilities that are away from where the incident occurred or where they live. And doing that then has made us then increase our awareness communication within the community to the GBV defenders, to the community health promoters, even when they do households, by taking them through what we call psychological first aid to identify abuse within the homes, not leaving out even those who are abled differently, because when you have a number of about 27 of them within the age group we're talking about who had been defiled and have also come to our facilities to talk about it, then we realize that we also need to be across board and talk about all of them, and as we create our awareness within the community and support the adolescents to come within our facilities. Let's include them in how the decisions that we make. And I like that we have yesterday, one of us also talked about the adolescent friendly using sports. During these communications, we are able to tell them where to go, give them the referral pathway, provide the facilities that are providing integrated services, reach out to specific people whom they feel they are very comfortable with through peers, because we have peers attached to our facilities. We have survivors network to provide these services. And also we have the paralegals who then we work with to be able to follow up the cases up to end of either prosecution level, and also integration back to the community, a very key component, so that when even after this, when they go back to the community, they are able not to be stigmatized because of having undergone an ordeal. Thank you.
Wow, thank you very much, Roslyn. I gave Roslyn all that time because she was covering two very important areas, themes. There was mental health and there was SGBV. And as she spoke, you could get really how the two are intertwined or how they are related, how one affects the other, yeah? You know, the SRH issues or SGBV issues can really have lasting impact on mental health and vice versa. Mental health issues can also increase one's vulnerability to be a victim or survivor, as we say, of SGBV issues. So thank you very much. You've also shared the good work you're doing with ensuring that SGBV response or management is integrated into other health issues. You've shared with us about the importance of safe spaces and the importance of engaging communities when it comes to SGBV and even mental health responses. Maybe I can pose to you a question as shared here by Ibrahim, or I don't know if Ibrahim is able to unmute and speak. Let me give him a second. Ibrahim? Okay, if you manage to speak at any point, just start speaking and I'll allow you to go on. But from the question he's typed on the chat, Ibrahim is from Sierra Leone with a population of about 8 million people, but the country has only one mental health hospital. How can we address mental health issues in a country like this? Also, we need to take mental health education to schools so that we can improve the mindset of these adolescents and youth. Somebody has given a response about ensuring that policies are supportive of mental health. So yes, we can have the policies and maybe we can also discuss further, how do we ensure that they are implemented, or that even the policymakers understand the importance of developing policies that support mental health up to the lowest levels. Kabana, maybe you can share with us your experience on how you moved mental health from one point and ensured that it was integrated at various levels, kindly.
Thank you very much. One of the issues we noted, as you have actually said, is that we cannot leave out mental health among adolescents because we also have the issues to do with NCDs. So we picked mental health and ensured an integration component is also important. So we have also identified the health facilities that where we are providing these mental health services. And other than that, we have gone to the point of ensuring that every sub-county within our county has a mental health coordinator, and where they are able to be involved. And that, because of the issue of the schools, we also have what you're calling a school health coordinator. And almost every month we have the issue, we work together with the school health and go to schools where we are able to provide these services in quotes using the appropriate language that the Ministry of Education wants us to do. But when we leave there, we ask the students to write for us on papers if there's anyone that has ever undergone any violation or what do they understand by mental health. And they'll either tell you like the mental health has only to do with mad people, but then it gives us a leeway to see how then do we address the issues from their point of view or from their perceptions on what do they understand about mental health? And then we are also able to ask the teachers after we have done such sessions to link us. We make time once a Friday afternoon, again, go back either to the schools or the children. If it's something that the teachers have noted that is interfering with their work, with their schooling, then they are referred to us. So what we have done, we are sharing, we work with the community itself, where we have done psychological first aid, terms of provision on the same, ensuring that every person that we work with has a base on how to provide these services so that they can be able to refer, even in the households, when the community health volunteers or promoters go to the households and they note something that is not very good, they are able to screen and ask the household member, the senior household member, that we would want to support you in this. And then even as you come to our health facilities, we have a screening tool, very basic, on asking on matters, IPV and simple mental health. What is it that you understand what it is? And if they need more further support, then we are also able to engage that. So we have tried also, it's also a matter that we are trying to engage. We have limited numbers, especially for the clinical psychologists, even our psychiatrists, but because of providing psychological first aid, it makes it very easy for us to be able to get the referrals that we appropriately need. And we have a very good support system within the mental health unit that also linked up with the GBV unit. We are able to, not smoothly, it has its bits and challenges because of people not understanding, even our own healthcare workers, but with continuous education, sensitization within the community, and everybody else who needs to be on board, and our stakeholders, we are working through it. Thank you.
Thank you very much, Roslyn. At this point, I would like to give an opportunity to members of our audience to ask questions that they might have, and I'll start with David. I see your hand is raised. Welcome, David. Just unmute and ask your question.
Okay, thank you very much. So my name is David from Ghana. I am the Executive Director of Youth Rise International, a youth organization that mobilizes young people and rural community to fight the intersection of extreme poverty and health disparities. We're also members of People's Vaccine Alliance, and they invited us to be part of this program. It's been such a great conversation so far, following and hearing the amazing thing that Rosalie has shared. I just want to share some few thoughts and also ask a question. We are running a project on newborn maternal mortality. We discovered that about 80% of the over 100 beneficiaries that are supported to this program were adolescents. And this adolescent group are usually the high risk population with a high level of cases of anemia and different birth complications that we discovered among them. The interesting thing we found was that, unfortunately, these young adolescent girls feel hesitant to access community health care in terms of attending antenatal clinics and postnatal clinics because of some form of stigma, ostracism, and different barriers. So they rather prefer to resort to herbal care or going to spiritual centers, to people that have not been trained to receive some kind of adolescent reproductive health services instead of going to the government facilities. And we discovered that some of those things is because of the fact that they feel like the community health centers are not trauma informed and they are not team friendly. Those young adolescent girls are looked down upon in the community. They are looked down upon by the healthcare professionals. They are included in the same antenatal clinics with the adult population who normally look down on them and stigmatize them. So we worked with the community healthcare system to embark on some serious intensive capacity building for healthcare professionals in how to create a team-friendly and trauma-informed care at the grassroots level, so that these adolescent population who are usually high risk to newborn and maternal mortality will be able to accept and attend the antenatal clinic, which is very critical in ensuring that they can give birth safely and then have their child alive. So I want to find out, I don't know whether this is similar in Kenya, in Sierra Leone, and other countries. What experiences are you facing in terms of young adolescent populations, especially the young girls who are pregnant and they're able to attend healthcare services, receive quality healthcare services, so that they can go through the 9 months of pregnancy without much complication, they can give birth safely and be fine. I'll be more than happy to learn from other countries and the experience. If it is a similar situation, how are you handling it? So we can also integrate some of those best practices into the current project that we are doing in order to ensure that we break the barrier that limits young adolescent girls from accessing quality healthcare so that they can give birth safely and have their child and be happy. Thank you.
Thank you very much, David, for sharing your experience as well as the question you've asked. So I invite any member of the audience, if you'd like to respond to David or make a remark or a question. David asked, from our experiences in our various different regions, how do we ensure that adolescents and young people have access to quality maternal health services, if I'm not wrong. So feel free to share your approaches. I'll also go to the chat and see if there are any questions there.
Hello, moderator. I note that our sexual reproductive health rights person is on board, and this would be very ideal. Maybe during her presentation, she can discuss on that.
Okay, who is that, please? Maybe I've not been alerted that she's come on board.
Esther Kiambati.
Okay, I didn't know she's now on board. Esther, kindly.
I don't know whether she's on board, but I am hoping, because that's actually her niche.
Yeah, we have been waiting for her. Esther Kiambati, are you here?
Let me look for her.
I think she
Unfortunately,
had a challenge.
Esther is not going to join us. She got an emergency.
Okay. We are sorry about that. Yes, so I welcome any member of the audience to share about their experience with supporting adolescents and youth to access quality sexual and reproductive health, as well as maternal health services from your various regions. It's open for anybody.
Okay,
Mlewa, maybe you can.
Okay.
Rosalind.
Sorry, let me try to answer that. From our perspective, what we have done, we have allowed the adolescent young persons to come on special days. We have their special clinics, and also we have some few specific adolescent responsive public facilities where we have given them room to also be part and parcel of running of the hospital, of running of the public facilities, in the sense that they are able to follow up on their peers to know where they are as they attend their antenatal care. And then they are also able to give feedback to us, or ensure that they actually register within what we call the NHIF, National Hospital Insurance Fund, or the Linda Mama, that they are able, so that if they have to come and deliver, then they are able to be supported without payment to deliver in our public facilities. And other than that, we have also ensured that we have reminders, and there's I know we have an app supported by one of the CSOs that they can be able to even send messages to and inquire and ask about the current conditions that they are in, and then they are given feedback on what it is and when to go to hospital. So those some of the few strategies that we've tried. And also, even as they come, when they come to deliver, our healthcare workers have been very responsive, especially in the high-level facilities where we know most of them will come. and support them throughout the delivery and also follow up. Thank you.
Thank you very much, Roslyn. Maybe I'll also invite Mlewa to comment. And before Mlewa comes in, Roslyn, you have talked about the peer-to-peer support. And I would like to add an approach similar to peer-to-peer is the mother-to-mother, where we have young mothers supporting fellow young mothers to attend the anti and postnatal clinics, to breastfeed for the duration that is required, and just to navigate even around the health facility. You've talked about Linda Mama, that is to do with ensuring that there are affordable services, or services are accessible, as the adolescents and youth won't have to pay from their pockets for services. So that is another way of ensuring access. Healthcare workers are trained to be able to provide adolescent and youth-friendly services, even at the maternal and child health clinics, and use of apps for those who can access the apps. They can get information from there, and maybe to add, you'll also find that they can get the linkages or a directory of where they can go for particular services. I would like to invite Onesmus to make a comment on that, and then we move to Lizzie. So Onesmus, then Lizzie.
Thank you. I think most of the things have been spoken to, but I would want to say, I think we need to adopt a private sector approach. Why am I saying private sector approach? Recently, we did conduct a survey on commodity availability and accessibility. And you find that certain commodities are either moving from public health facilities, but they are quickly moving from private healthcare facilities. Well, what is the difference? What is the private sector doing that the public sector is not doing? I think we have seen it most of the times that a doctor, a nurse, the way they will actually attend to you when they're in Nairobi hospital or in a private health facility setting is totally different from the way they handle you when you go to a local dispensary, which is a public health facility. I think there is a need to adopt the private sector model where we look at a client as a potential source of your work. I mean, you're there because of a client. There is an increased acceptance, and even the way the private sector treats their clients is extremely different. I mean, you walk into a pharmacy, the way people talk to you there, tomorrow you quickly come back. I mean, you can almost get anything in a pharmacy in a manner that you want it, so discreet that you will not need to worry who actually you meet at the pharmacy when you go to pick your product, because they have understood you, they know what you want, and they will give it to you the way you want it. So I think that that's the approach we really need to adopt, a private sector approach that treats clients as customers who actually have needs, who actually have their privacy, who actually needs to be attended in a manner that they feel very comfortable. Just to add to the many things that others have said. Thank you.
Thank you very much, Onesmus. Lizzie?
Great, thank you, Marie. So quick one, and this goes back to Roslyn, especially in terms of the SGBV and the amazing work that they're doing. I'm just a bit concerned when we're addressing youth in terms of SGBV, or when we're talking about sexual reproductive health. There's a key issue that goes unaddressed, or we assume it's already being addressed while youth go to healthcare facilities to access services. And Rosalind, I wanted to know how you're tackling health data in terms of privacy, because if I have been sexually violated by somebody within our household, maybe perhaps my uncle or my dad, there's some level of privacy or security that I expect. And if I'm walking into this kind of facilities, how are you handling my health data? And how private is it? Is there some sort of a consent form? Is there some sort of an agreement you get into, especially with the adolescent, because they do not access healthcare facilities because they know maybe, this information will be used against them in a discriminatory way. So the next time they will, they won't come back for these services again. So I wanted to know how you're tackling that particular angle, Rosemary. And I don't know whether Mlewa has some insight, especially when it comes to sexual reproductive health services and commodities. I mean, accessing condoms itself should be free. It becomes an issue because we're not so sure whether the youth trust the healthcare professionals. And even in terms of accessing, PrEP HIV services, how private is it that when I walk to these facilities that you're saying there's like a time schedule just for youth to access the facilities? Is there some level of privacy, some level of trust being built? Is there like a framework that protects their information while they come to your facilities? So it will be good to just get feedback on that.
Thank you, Lizzie. So Rosalind, maybe you can take about 2 or 3 minutes as we are almost out of time. Over to you, Rosalind.
Thank you very much. Thank you very much, moderator. Actually, what we do is, of course, we are governed by the data protection. Any youth or adolescent walking into our facilities will be guided. In most of the facilities that we have, especially when we are dealing with survivors, SGBV or SRHR, we always have what we call the social workers, who are very key in terms of ensuring that they will work with that person until the end of the service that is provided. And of course, in our data, I mean, the entry of our files are very confidential, and they are under lock and key. And of course, we have an EMR system, where we are able to load our data to our KHIS. So you might see the numbers on the KHIS, but it will not give you the names. And if it's a matter for confidentiality, it's for only those who need to know, where referrals are confidentially done. If it's a matter that needs to go out of the facility, then again, it is for those who need to know, and the referral pathway is very specific. And even use of calls and to specific people or to specific service providers who will be able to provide us with this service. So yes, we are maintaining the issue of data protection very highly, like it is expected at all levels in terms of health systems, health information management systems, and also using the national data protection policy guidelines that are there. And of course, we have our adolescent framework and the reproductive and maternal neonatal child health policy that very governs on how the data is supposed, or the confidentiality for the youth to be able to access these services is outlined. Thank you.
Thank you very much, Rosalind. I think we have come towards the end of our session. It was also supposed to be a networking session, and I'm seeing participants sharing their contacts through the chat. Kindly continue with the networking, pick up one another's contacts, reach out to one another. I believe it's been such an enlightening session. So we have been able to cover provision of accurate SRH information and access to the same, then accessibility and quality, GBV prevention and response services. We were not able to adequately cover leveraging technology and digital health solutions, but we hope that the organizers can see where to fit that, maybe in a later session, or we will look out for other opportunities, other conferences where we can get more enlightened on that. We've covered partnerships with government, NGOs, private sector. I made sure to add FBOs there. And that is for sustainable adolescent and youth SRH and mental health support. We've managed to cover innovative approaches, including integration, and we've covered overcoming cultural and other societal barriers to adolescent SRH and mental health discussions. So at this juncture, I would like to hand this over back to the organizers Collins kindly take over. Thank you very much.
Thank you so much, Maria. And you've mentioned something very much important in regards to technology, how technology can be incorporated in helping the youth overcome mental health. And as a team, we are working on bringing in different aspects of dialogue with different institutions. And we have a plan for next year to delve in a conference on focusing on technology. And this will happen immediately after the run that we'll have on the same week. So just we'll share more information with you after this because mental health, it's something that involves a joint effort. If we all come together and give mental health a priority, the same way as we give some other areas, we'll be able to help the youth, especially if we capitalize on the technology aspect. And also, if we create forums whereby we'll be able to share ideas from people from Nigeria, Ghana, and see how their policies work. Like now in Zambia, I understand in Zambia, in terms of mental health policy, they are at par. And it was ruled in their parliament that when someone dies of suicide, it's just the same way somebody can die or of a disease. Like we in Kenya, we still believe it commits suicide, but in Ghana, when it comes to that, there is an aspect of die of suicide. So thank you so much, ladies and gentlemen, delegates and panelists. I know it's been a struggle in terms of internet. I don't know what's happening in Kenya. So there have been a lot of issue on, but we believe the information and the discussion that we've had here, it's going to materialize into something good. It's going to bring in solutions that will be useful for the youth in reproductive health sphere, and also as well as mental health, because these two needs to work together. At this point, ladies and gentlemen, we are going to have our break, which is going to take around 1 hour, 10 minutes. So we have some 2 sessions that we have in our afternoon part of the time. It is going to be very engaging. We have the role of the youth in universal health care, because now when the aspect of the, we call it mental health, we have how is it going to be affordable for the youth, and what role can they play in realization that the UHC is achieved. And after that, we shall have another interesting session, which it will touch on the vaccination. So vaccine has been, especially among the adolescents, there have been a lot of stereotypes on adolescents. How can young people play a role? Because you see, anything affects a young person, normally they need to be part of, or they need to be on the table, and not that they need to be tailor-made for something and then they are given now to consume. That's not going to be effective, because there'll be a lot of stereotype in it. Why were we not involved in inception point? So ladies and gentlemen, please have your, enjoy the rest of your afternoon. Let's come back exactly 1 p.m. I mean 2 p.m. But sessions will start exactly 2:30. At that point, I'd like to say thank you to institutions which have made this event a success, and see you then for our 2 sessions. May God bless you.
mental health, including anxiety. The Responsible Gambling Practices and Harm Reduction Symposium, curated by the Youth Initiative Development Program, YIDP, is a timely and crucial event aimed at addressing the pressing issue of gambling addiction in Kenya. With the country experiencing one of the highest rates of gambling in the world, the negative impact on mental health, including anxiety, depression, and low self-esteem, is a significant concern. Scheduled to take place in Kisumu, Kenya, from March 28 to 29 to March 2024. This symposium presents a valuable opportunity to bring together key stakeholders from various sectors. Representatives from the gambling industry, mental health professionals, academics, government officials, youth advocates, and community leaders will converge to foster dialogue and knowledge exchange on this critical issue. The symposium's primary goal is to develop collaborative strategies to promote responsible gambling practices and reduce harm among young gamblers in Kenya, with a strong emphasis on safeguarding their mental well-being. By engaging in insightful discussions, attendees will explore effective ways to tackle gambling addiction and its detrimental effects on the youth. YIDP's commitment to addressing the mental health challenges caused by gambling demonstrates its dedication to creating a sustainable and healthy community for the youth. As a platform for valuable discussions and idea sharing, this symposium will undoubtedly contribute to the advancement of responsible gambling practices and the protection of the mental well-being of the youth in Kenya. Participants at the Responsible Gambling Practices and Harm Reduction Symposium will play an active role in shaping the future of responsible gambling in the country. By working together, they can develop concrete strategies to reduce the harm caused by gambling addiction and create a safer environment for the young generation. Don't miss this opportunity to be part of a significant step towards positive change in Kenya's gambling landscape. Join us in Kisumu for the symposium and become a catalyst for promoting mental well-being and responsible gambling practices among the youth. Together, we can make a difference and build a healthier future for the next generation. The Responsible Gambling Practices and Harm Reduction Symposium, curated by the Youth Initiative Development Program, YIDP, is a timely and crucial event of impact on mental health, including anxiety, depression, and low self-esteem, is a significant concern. Scheduled to take place in Kisumu, Kenya, from March 28 to 29 to March 2024. This symposium presents
Okay, I can see you're giving us thumbs up. It means it's well.
Yes, I believe it works now. Thank you.
It's also working on my end.
Oh, nice.
That's good.
Thank you. I'm glad.
Hello, everyone.
I was worried, but now Zachary, I can see you. I am excited to see you, Zachary. Feel at home.
Honestly,
I know you are going to enjoy this session. Yes, so the moderator of the day is going to be Dr. Opon. Is here with us. I'm not going to take a lot of time. I'm going to, can you hear me? Yes. Okay. I'm not going to take a lot of time, ladies and gentlemen. I'm just here to echo a bit of the importance of the youth identifying their role in advancing and accelerating the UHC in Africa. It's been an important thing when we are talking about the youth health, and when we are talking about the affordability, and when we are talking about maybe the innovation that it takes to roll out the UHC, youth should also know which role they can play. Ladies and gentlemen, at this point of time, I'm going to welcome Dr. Shadrach Opon. I can see you, who is the Senior Technical Advisor, Health System Strengthening, AMREF Health Africa, Kenya. Dr. Opon, enjoy the session. Can you hear me, Dr. Opon? Over to you. Ladies and gentlemen, I think Dr. Opon is facing some challenge.
Yes, Collins, can you hear me?
Yeah. You are loud and clear, Daktari. How are you doing?
I'm good. I don't know if can you see me as well. I'm at the airport and quite some noisy background you might experience, but I want to confirm that you can hear and see me.
Yes, I can hear you well, and I can see you, Daktari. Go ahead.
Okay, thanks, Collins. So at this point, we are still testing the mic, so we are already on. I didn't get that.
At this point, now we are on because it has heated. We are 3 minutes past time. So please take us through the session. You are on mute. Let's have a moment. Our technical team, please take me to the main master page presentation with speakers. Robinson. Okay, so ladies and gentlemen, if Dr. Opon, you are back, you can interrupt me to take over. So today's speakers or panelists, we have, we've tried to blend the. Okay, thank you. You are back, Daktari. All right, we have blended the panel, and of course, the moderator for today is going to be Dr. Opon. And just a moment of a minute, Dr. Sarah, you can introduce yourself, then let the delegates know who you are. And yes, just a minute for introduction. And then I'll go to Zachary, then I'll go to Shreya, then I'll go to Sinam.
Thank you, Collins. My name is Sarah Kiptines. I am a medical doctor and family physician working at Penda Health. I have the role of head of medical services at Penda. Penda Health is a 19 medical center primary healthcare organization in Nairobi, Kenya. We have 19 medical centers, as I mentioned, Penda medical centers, and we have a robust telemedicine center as well. We serve about 30,000 patients a month in our physical medical centers and 1,200 a month telemedicine patients. We also have a very robust call center where we have engagements of about 100,000 chats, inbound conversations that comes from our patients. So going through the session, I'll be talking a bit about how digital health has supported universal healthcare coverage. But I just wanted to give you a background of where I come from so that as we go into that session, you'll understand where my points are coming from. I'm very happy to be here and to learn from the team of panelists we have this afternoon. Thank you.
Thank you so much. Daktari, are you there now? Can you take over?
Yes, Collins, thanks for this. Please confirm that I'm loud and clear from your end.
Yes, you are. Please go ahead.
Thank you very much. So as Collins mentioned, my name is Dr. Shadrack Opon. I'm a senior technical advisor, health system strengthening at AMREF Health Africa in Kenya. It's a pleasure having this discussion with the team. I want to allow everyone to introduce themselves. Collins, we had the whole introduction from the team, so we can just quickly go to the overview before we have before we set off our conversation, right?
Not yet. Dr. Sarah has gone first, so we are going to Dr. Isaac, then Shreya.
All right, so Isaac, please take on the stage and introduce yourself to the so wonderful team. Over.
All right. Good afternoon, everyone. Good morning, depending on your time zone. Zachary Siaka Osheku is my name. I'm a public health professional with about a decade experience cutting across supply chain management, private sector, government initiatives, and I'm popularly known as the voice of primary healthcare, particularly here in Nigeria and in some other countries within the African region. And I happen to be the founder and the executive director of PHC Initiative Africa, which is a non-profit organization disrupting irregularities in the Nigerian healthcare system and Africa at large. Through our multi-sectoral approach to primary healthcare delivery, we promote simple, innovative, cost-effective, locally adaptable strategies that are designed to improve health system. And, and our work also promotes health equality, equity, and optimize healthcare outcomes for the most vulnerable. So this discussion at this point in time is quite apt, discussing the role of youth in advancing universal health coverage in Africa. Thank you very much.
Thank you very much, Zachary, for that wonderful introduction. I think we can move to Dr. Sarah.
I had already introduced myself. Do you want me to reintroduce?
All right, thanks, Dr. Sarah, for that. Shreya, over to you.
Yeah, just one moment. Can you all hear me?
Yes.
Okay, great. So hi, everyone. First off, thank you so much to Mr. Collins and YIDP for this wonderful speaking opportunity. I'm super excited to be here today and share my insights all the way from the United States. So my name is Shreya Venkat. I am 20 years old and I'm a fourth-year university student at Georgetown University in Washington, D.C. I'm currently pursuing my bachelor's and accelerated master's degree in global health, and I'm also the founder and CEO of the nonprofit Nest for Us, which was formed as a philanthropic platform built upon kindness, generosity, and social good. And what began as a small project 7 years ago is now a multifaceted global organization fueled by over 6,000 volunteers who altogether have contributed over $3 million in value of volunteer hours, impacting tens of thousands in over 30 countries across 6 continents with the support of many public-private partnerships at all levels. Over the past actually 13 years now, I've contributed over 5,500 hours of service, advancing social progress worldwide by supporting causes ranging from global hunger, social justice, and climate action to quality education, poverty, and health equity, the topic we're discussing in today's session. And my career aspirations post-graduation center around healthcare policy, uniting my passions for health equity, climate activism, and volunteerism to aid marginalized communities worldwide. I'm excited to be here today and grateful for the opportunity to share my insights on this wonderful platform. So thank you so much again for having me. I will put my contact info in the chat, and I look forward to hearing the insights from my fellow panelists and sharing a little bit of mine later on today. Thank you.
That's wonderful, Shreya. Thanks for that kind of introduction. So can we cross over to Dr. Cinnamon?
She will be late. Sorry for that.
Right. All right. Thanks, Collins. So I think I want to give quite some overview of this session today. And UHC, Universal Health Coverage, is quite close to my heart. And while speaking of this, what comes to my mind all the time is the role of youth in advancing UHC in Africa. Most of the time, when we speak about UHC, we are looking at a situation where everyone is able to access quality health services without risking what we are calling financial catastrophe. And what this means is that we want to be able to access health without having to sell our household items or without being pushed into poverty as a result of accessing healthcare. So most of the time, we have spoken about this with the government in mind, but at minimal times do we speak of what is it that is the role of the youth in all these advances that has been made. A lot of countries have made a collaborative efforts in the past to advance the UHC agenda within Africa as well. So we want to recognize the power of youth engagement, innovations that are coming from the youth, as well as advocacy in shaping active involvement of the youth, as well as budget allocations that would then promote quality access to healthcare services for all. So this session will help us highlight some of the successful youth-led initiatives and innovative approaches, as well as the partnerships that would contribute to achieving some of the goals around the UHC in Africa. So the outcomes that we anticipate from this powerful panel that we'll achieve today are around increasing awareness of the significance of youth engagement and participation in advancing UHC. We can already hear what Shreya is doing with the organization, what Penda Health is doing here in Kenya, the contribution of the PHC initiative from Zachary. These are some of the milestones that we want to highlight as things that are coming from the contribution and engagement of the youth in this continent. So we would also like to hear some of the initiatives that are coming up besides what we already have, and recommendations that we want to make to governments as youth. What do we want to tell the stakeholders that we want to see as the youths in this continent in terms of strengthening the partnerships and collaborations among youth-led organizations as well as governments in their effort to advance UHC. So we also want to seek areas of empowerment. How can we empower our youth to take active role in advancing UHC, as well as promoting research, entrepreneurship around healthcare sector, and understanding the whole role of data and digital health technologies in achieving UHC in Africa. So because of the powerful audience that we have quite a number of youth leaders and activists joining us today as participants, government officials, policymakers, NGOs, including AMREF, where I'm coming from, as well as stakeholders from academia. So having given that background of our conversation today, I want to quickly start engaging our panelists on their thoughts, and allow me to start with Zachary. Zachary, what you are doing with the PHC Initiative Africa is great. Are you able to, would you please identify for us some of the opportunities that you see that exist for youth active involvement in healthcare financing mechanisms, and how some of the youth leaders that we have can actually contribute to sustainable funding models that would then support the implementation of UHC in Africa? Over to you, Zachary.
All right, thank you very much, Dr. Shadrach Okon, for giving me the opportunity to be the first speaker. Thank you very much. I'm quite humbled. Well, first of all, I would like to thank the organizers of these August events. It's quite apt considering that we're just less than a decade, just few years between 2030 agenda, UHC agenda, okay, or SDG, as you may say. All right. First of all, we from PHC Initiative Africa, we have been doing advocacy in terms of trying to see how we could mobilize our youths to ensure that we have proper budgetary allocation going into healthcare system. I could remember precisely in 2001, we had what we call the Abuja Declaration, where all the African Union members met in Abuja. Nigeria was the host of the events, unfortunately. And this is about 20 years after. We are not seeing any tremendous progress in terms of, meeting that 15% budgetary allocation going to health up to this very moment. So part of the things that we've been doing, we have successfully advocated for some state minister of health to increase their budgetary allocations to health by investing properly in the health sector, because investing in health is actually, spending money on health is an investment. It's an investment which has a multi-sectoral effects on other sectors of the economy as well. And part of the things we've been doing is we have what we call My Health Sure, which is a sustainable community-centered advocacy trying to advocate for universal health coverage at the grassroots, whereby we mobilize young people, particularly the youth from 35 years downward, to be involved in advocacy at the grassroots. Because we realize that if you look at it, over 70% of our population consists of the young people below the age of 30. And this gives us this opportunity to actually leverage this quite number, of having 70% of your population going to the young people. And this particular set of people, young people, should be brought to the fore in terms of leading activism, leading in advocacy, calling for policy reforms by government, asking for government to prioritize budgetary allocation on health and all that. And most times, part of the things that we've been able to do, because we realize in order for us to meet the attainment of universal health coverage by 2030, there is a need for every young person to ensure he or she has some level of health insurance coverage for themselves. Because doing that alone would have achieved 70% of our population cover under universal health coverage. I don't think here in Africa we have any country that has up to 70% universal health coverage. I doubt if we have. The last time I checked, I could remember a country like Gabon was talking about close to 50 and some others, But Nigeria is a giant of Africa. In this case, we're not giants because we only have less than 10%, considering our population, which is over 206 million people. Less than 10% of Nigerians are covered under health insurance. You can imagine if properly advocated for that all youths who fall within the age of 30, that makes up this large chunk of our population to be pioneers in terms of not just believing in universal health coverage, but by leading in terms of ensuring that they provide some level of financial protection via their health access. So it's going to go a long way in ensuring that we attain universal health coverage. And apart from that, most of our health system, we have a very porous health system. COVID-19 has shown how that has been in most African countries. So part of the things that we need to do and is to ensure health system strengthening. We mobilize young people in ensuring that they take active part in terms of all the 6 pillars of health system strengthening according to the WHO building framework, which has to do with ensuring access to effective medicines, quality medicines and technology, ensuring good governance and leadership at the facility level. Let me quickly share a bit story about this. In terms of governance and leadership,
Have we lost Zachary?
Realize as some of the PCs, they have millions of naira in their budget, in their purse, but they were scared to utilize this money to provide health insurance because there is a gap in terms of governance and leadership. They don't really understand what financial management system is. So we as an organization, this time around, we're not talking about not having the money. The money is there, but utilization was quite very poor. So it's a problem. We need to understand, we need to address all the 6 pillars of health system strengthening up to the point of financing. In as much as government has not really government has failed to meet up its responsibility in terms of budgeting 15% to healthcare. Also, we need to harness other domestic sources of revenue generation. We can begin to tax some unhealthy food, like the tax on sugar, tax on tobacco, all these are products that don't really contribute much to our entire health ecosystem. There's need for us to generate huge resources from taxing all these unhealthy products, such as tobacco, sugary substances. These monies generated from all these sources can be channeled in terms of boosting our financial revenue to actually provide health insurance for all, to all the citizens of the country. And also talking about service delivery, there are quite a number of things we can do. We need to ensure we have proper, sources of vaccine. What do we need to do? There has to be health industrialization in such a way that we Africans, we should be able to own up to our responsibilities to provide all our health commodities, if not all, at least 70% of our health commodities, we should be able to provide for ourselves, because doing that, it's the effect on the entire African economy is going to be massive, because it will tell that more money is going to be plowed into the African economy. People are not going to be unemployed, and we all know the effects of all of these in terms of our health. Well, I don't want to say much at this point in time. Let me pause here. Thank you.
Thank you very much, Zachary. The idea of treating the whole health sector as a system, I think you have brought out the idea of you having systems thinking in mind while addressing issues UHC, considering all the components of healthcare. That would be very important to address and not look at these components in isolation. So I will come back to you, Zachary, around your thoughts on how youth-led organizations can collaborate with the government. But I want to bring on board Shreya to give us her thoughts on where she's seeing the youth, what the contribution of the youth would be in advancing UHC in Africa. Shreya, over to you.
Yeah, thank you so much for your question. So I think broadly speaking, acknowledging the interconnected nature of social determinants of health and how each facilitates or hinders the systemic inequities that persist in health systems worldwide is absolutely critical. Rather than regarding them as distinct, isolated entities, like my fellow panelists had mentioned, especially due to the fact that health systems themselves are complexly interdependent, one key innovative approach that should be incorporated into any action plan designed to address health inequity is analyzing the gaps in health systems from a community lens. And this is actually a twofold approach, as it not only ensures that underserved voices are represented in decision-making spaces, but also provides young leaders with opportunities to voice their perspectives and ideas in spaces conventionally dominated by adults. Additionally, young leaders can supplement the previous approach by leveraging a wide variety of technological mediums, from public health campaigns on social media to innovative digital apps based around telehealth advancements, in order to disseminate information to community members in a reliable, culturally competent, and accessible way. And through my nonprofit organization, S4S, we've seen the powerful impact of equipping young people with avenues of opportunity. Opportunity is one of my favorite words. I always like to use it as kind of a means of, I guess, harnessing or equipping community members with the tools and the pathways that they need in order to use their specific unique gifts. And when you provide young people with these avenues for opportunity to voice their unique ideas and spearhead community-driven initiatives, you end up fostering greater equity in the process. However, what I've seen over the years is not just purely youth empowerment, but also how pivotal intergenerational collaboration can be. So, transforming social systems in a way that builds upon the skill sets of each and every individual community, adult or child, to enact meaningful change. So not just relying solely on youth involvement or adult decision-making, but figuring out a way to bridge the two in order to create more community-driven solutions. So I'm excited to hear what the rest of the panelists have to share. Thank you.
Thanks, Shreya. I think those are very wonderful remarks around how the youth can actually be involved in terms of empowerment and as youth advocates to champion the UHC journey. I think you are doing quite a wonderful job around that. And I will also engage you further on some of the innovative approaches that we can that we are exhausting as of now, as they want to bring on I want to bring on a lot of great work around digital health and providing health services deep to the community. Where do you see the role of the youth in all of this process? How can we meaningfully involve the youth in this journey of UHC? Over to you, Sarah.
Hi, Dr. Riwi. You broke off at the beginning of your question. So you, just for the sake of everyone, you may need to ask it again. I think we only got the end.
Thanks, Sarah, for picking that up. As I was saying, the work that Penda Health is doing is recognizable, and we acknowledge the efforts that Penda Health has made towards driving UHC through digital health. So bringing you on board to just walk us through where you see the role of the youth. How can we bring the youth on board to meaningfully involve them towards the journey of UHC? Over to you.
Okay, thank you. Thank you, Dr. Ari. Just to give a background so that there's understanding on how exactly digital health technologies come in place at the point of health service delivery. I think Zachary and Shri have spoken very well about policy development, advocacy. And so I'm coming back to how things are. I'm going to speak more on how we actually implement these strategies and then how the youth can take part and help support these digital health technologies. So as I had mentioned, Penda Health is a group of medical centers. So we started in 2011 as physical medical centers, and from even just writing notes physically, files, and many of you have gone to facilities where your file is brought out physically. Over the years of expansion in 2017, we now transitioned to an electronic health record. And I won't talk a lot about that in this setting, because that's now from the clinical end, just how electronic health records just help supported, make patient management and documentation very clear and consistent. But I won't focus much on that right now. Then in 2020, as you all know, we faced the COVID pandemic. And one of the challenges we faced as a primary healthcare facility was how to stay connected with our clients. And of particular concern, a lot of our clients are youth. In fact, 68% of people who come to Penda Medical Centers are between the age of 20 and 35. And so one challenge we faced during the COVID pandemic was these men and women with their children accessing healthcare, because a lot of fear and stigma was created during the pandemic. People were afraid of coming into the facility. And our children in particular, especially related with their vaccinations, was an area of concern, because we had very many families not being able to access or being concerned and worried about, getting COVID, even if they go for their routine preventative healthcare services, something as routine as well, baby or vaccinations. And so what we did was we developed a Stay Connected campaign where we were reaching out physically on phone and via SMS to our patients. And we'd reach out to them and remind them. And because of that active engagement through telecommunication, we were able to vaccinate, keep 95% of our patients continue their vaccination journey during the COVID pandemic. So what we realized from that was that actually beyond the physical connection we get in terms of waiting for our patients to come in, there's a very viable approach in actively engaging via telecommunications and other digital health platforms to reach our patients. And so in 2021, we developed our telemedicine center. And it was a very engaging and exciting opportunity, because what we did is we developed a call center. We built up our call center to also involve WhatsApp engagements and our physical calls, and then paid teleconsultations for 195 Kenya shillings, which is about 1.5 USD. And what resulted from that is right now we're seeing 1,200 teleconsultations, which is paid phone conversations of people consulting to reach for their general primary healthcare needs. And we have over 100,000 inbound WhatsApp engagements just for patients asking questions about how to access facilities and also initiating discussions on current health concerns. So through that whole season, Penda has evolved from a physical primary healthcare facility where we have, the brick and mortar people coming into the medical center, to what we call now blended healthcare facility. And the additive effect of the digital technologies, especially telemedicine, And just engagement has been very helpful in increasing access. So we have over about 25% of our clients on telemedicine are out of Nairobi or out of our jurisdiction where our medical centers are. And we're able to consult, send prescriptions via WhatsApp, and also refer in the case of acute care or tertiary healthcare. Many times we find that especially the youth use telemedicine platforms to discuss or to inquire about things related to sexual reproductive health. As mentioned in the earlier panel discussion, session 8, there's a lot of stigma and concern and fear of youth entering facilities and discussing sexual health related issues. And we found up to 80% of the engagements we have through telemedicine or WhatsApp chats are related to sexual reproductive health issues. And we're able to discuss, give appropriate consultation, recommend for testing, treatment, and create a safe space that now allows them to come to the medical center, at least having that fast barrier broken down. So in terms of access, digital health has been very helpful. There's also been a lot in terms of health education. Whenever you come to a medical center, as I mentioned, a Penda Medical Center, we've blended the digital health technologies there. So from the time you register, get seen, your lab results, even from the physical interaction, are sent directly to you at WhatsApp, via WhatsApp on your WhatsApp number as you go through the patient's journey in the medical center. So even before you return to your doctor for review, you're able to also see your lab results, which is a level of patient engagement during the journey of your health service delivery in the medical center. And also opening transparency for many of you in Kenya, and I believe in many other African health facilities. Sometimes even just accessing your medical records is very difficult. But because of merging our electronic medical record with these digital platforms, such as something as simple as WhatsApp that many people have access to, we're able to have patients access their health records digitally, and own that journey of own their primary healthcare journey at Penda Health. And so one way we do believe that the youth can really support these digital health technologies is basically being the youth. We are the technologically woke, if I could use a youthful word, in terms of we are creative, we have the technological expertise, and if you have the passion for healthcare improvements, just that alone will be so helpful, because we need digital health ambassadors in the healthcare sector in encouraging universal health coverage. It's very difficult to achieve UHC primarily using the brick and mortar physical medical facilities. The access, the ability to engage, the ability to get information through digital health technologies is so large. From the usual social media platforms we have, from developing content, we have very creative content creators and ambassadors who are able, if they took time to use these platforms to discuss the importance of universal health coverage, to encourage the adoption of telemedicine, is in our country, in areas where accessibility is difficult, is very, very important. So that's a brief of how digital health technologies are working right now, and can work in the physical, in our primary healthcare setting in Kenya and across Africa. And I'd like to hear more from the team and answer any questions or clarifications people may have. Thank you for this opportunity.
Thanks, Dr. for that comprehensive illustration on how the youth can be involved, especially through digital technologies to advance UHC. I'm actually impressed with what PENDA has done around vaccination, especially when the country was in dire need of the coverage of the vaccines. So I will come back to you, especially to get more insight around issues that might need policy changes in terms of access to youth-friendly services around RMNCH services, mother and child. Are there some implications that PENDA is foreseeing as an implication of having that kind of information accessible through digital platforms, or some of the policy changes that you want to see to help advance technology in areas of RMNCH as well? So thank you very much, Dr. I will come back to you with that for some more insights from what you're already doing and how we can engage youth further on the same. So we want to proceed to the next session, the next section of this, the 9th session of this conference, and just invite some of the questions from the participants before I go back to our panelists. While doing that, I want to check with the technical team if Cinnamon is now here for some remarks before we can continue.
Yes, here, Dr. All right. Can I go ahead or?
You're breaking a little bit. You can give us some remarks around. Please go ahead. Please go ahead, Cinnamon.
Okay. Sorry about my lateness. I think I got caught up in the International Youth Day celebrations, but I'm really glad for the opportunity that I have here to be able to share my small insights in regarding the role of youth in advancing HC. First of all, thank you for the title. I'm not yet a doctor though. I'm almost in the next month or so, I'll be starting my final year of med school. And yeah, and for sure, I have been able to, participate in forums, and I've been able to engage in critical conversations around UHC. And I do believe my insights, or probably my little experience that I've had in my years of med school, can be able to contribute to this crucial conversation today. So a little bit of background, like I mentioned, I am a final year medical student, soon to be, and currently in my, my advocacy and advocacy journey, I do chair the Kenya Healthcare Student Summit, which is a forum for all health science students from across the country. And we aim at building the capacity of all Kenyan healthcare students on matters pertaining to universal health coverage, and also equipping with the necessary skills that will be helpful in their future profession as healthcare practitioners. And even in our discussions, when we congregate different leaders from the various courses, we really do talk about engaging the youth and how we try to bring out the meaningful youth engagement in such conversations. And we recognize that the future of healthcare in the continent depends largely on innovation and human capital, especially the young. But in order to translate the potential of Africa's young people into concrete results, Africa's youth must move quickly from back-end support systems to more front-end leadership roles. So we do find ourselves in situations where somebody might have the passion, the skills, but doesn't necessarily have the platform to showcase the skills or have the proper guidance and mentorship to be able to, do the absolute best and contribute to the health agenda within the country. And youth-centered initiatives aid this process by creating platforms for young people to own and take leadership roles in health systems on the continent, and with the right opportunities to strengthen the understanding of the geopolitical dynamics coupled with like the politics of global health, governance, and its implications. These young leaders will affirm and improve Africa's own health system and the continent's place in the global health architecture. So allow me to also talk a bit about, so recently there was the public health order that was recently launched by the Africa CDC. And now that we have the roadmap like to help the continent achieve health security, we do acknowledge that young people are really critical in reforming Africa's public health systems, of course, due to their potential and the knowledge and the skill set that they bring on board, and to be able to bring around sustainable changes in the health sector. And we do acknowledge that meaningful youth engagement is essential for advancing sustainable health and achieving UHC at large. And it's through engaging the youth that we are able to contribute our unique perspectives and expertise to health security issues, and also play a huge role in shaping policies and programs that impact their communities. Also, regarding, I also like the conversation around primary healthcare and as a crucial turning point in achieving UHC. So a bit about med school and even but just health school just generally is, even as the turning point, education is becoming more and more expensive, and we are projecting by the time that we are probably in the next couple of years, it will practically be very less affordable for students coming from poor backgrounds or not like well-abled backgrounds. And it's becoming a challenge because it's really we are shifting perspectives from more of a curative side to a more preventive side. And if we do not have the people that are coming from this particular backgrounds who have direct and contact and experience on how to deal with such situations, it becomes a challenge because we are not basically like addressing the issues that are coming from that particular point. So even as young leaders, even as people, we are trying to find our space in the healthcare sector and advocate for our voice to be heard, even in platforms where doctors are involved, where young innovators are involved, where policymakers are involved. We are faced with the challenge of, maybe being seen as youngins who have not like really had much experience with the healthcare field, which is not entirely false, but we do want to be able to leverage on the power and the skill set that the youth have, and just engage them at that level and see how best they can be able to achieve the particular goals and objectives that we need to achieve. And it's really important that we are guided and mentored into these particular spaces, because as future healthcare practitioners, we are definitely going to, have those seats at the table, and we want to get that experience as early as now to be able to make better decisions and ensure good health and well-being for all at large. So I think that was my time. I'll just hand it over back to you for questions and comments.
Thank you very much, Dr. for those comments. I am glad that you have raised the issue of public health order and the role the youth has to play around this. When this was launched, I think we have always been very keen on the contribution or the place of the youth in achieving the Africa CDC's public health order. It's inspiring to hear you speak of the same as we are asking ourselves where is our weak public health order is in terms of conversation is coming on here, and for our own learning as well. So in the interest of time, I want to invite just closing remarks from our panelists. Let me start with Shreya. Shreya, while you are giving these closing remarks, please could you also talk briefly, just briefly in a minute or so, how we can continuously advocate for preventive health measures and health education, focusing especially on non-communicable diseases. These are some of the issues that as youths, we have a lot of stake and role to play. Over to you, Shreya.
Yeah, no, thank you so much. So to me, I believe that one of the most effective ways to do this is equipping community members with personal agency over the solutions to issues that directly impact them. And this can be done in a large range of ways, but I believe that skills building and professional development might be two of the most cost-effective, replicable, and productive ways to implement these in communities that may have varying sociocultural foundations. And to your question, you had mentioned addressing non-communicable diseases in particular, for which this approach is fundamental, because these type of illnesses cannot be fixed with X amount of medications or vaccines or other clinical treatments. It requires approaches that target not only the physical nature of humans, but also the mental and emotional spheres. Hence, health education focused around prevention, mitigation, and other proactive means, rather than reactive measures that traditional biomedical frameworks utilize, is key to instigate social behavior change. And if you look at Kenya, ranked one of the best healthcare systems in East Africa presently, Kenya is a regional front runner in effectuating this vision if it continues to leverage cross-sectoral domestic support and international aid to bridge enduring gaps in its overall health system. An integrated process accounting for patient-centric care and encompassing everything from youth-driven policy-based decision-making mechanisms to localized grassroots investment cannot be underscored if universal health coverage is intended to be fulfilled before the end of the decade. And I'd be delighted to connect with all of you here in order to help prioritize youth voices in decision-making spaces. So thank you so much again for this opportunity to share my thoughts. I learned a lot today, and I hope that my insights were able to contribute fruitfully towards this discussion as well. I look forward to seeing how we can all work together to ensure that our health systems become more equitable in the near future. Thank you.
Thank you very much, Shreya, for, of course, always offering to collaborate and work together with everyone. That is very inspiring of you. And very quickly, I promise to bring back Zachary. Zachary, in your closing remarks, please briefly, how can the youth-led organization collaborate with governments to advance PHC, UHC agenda through PHC? Over to you, Zachary, in a minute.
Okay, well, quite difficult to do that in a minute, but let me just try. One of the things that youth-led organization can do to partner with government agency for the advancements on universal health coverage is one. First of all, in the area of advocacy, youth can actually play an important role, because in most cases, when you get the role to be at the forefront, engaging themselves, their fellow counterparts listen to them more, because they understand they are speaking from the perspective of the youth. So in terms of advocacy, it's going to play a very big, important role. And secondly, in terms of community mobilization, because the youth, the young people are mostly at the community level. So in order for your message to properly sink to the grassroots, the youth must also be at the forefront. Let me give you a typical example. Like we have what we call the PHC Advocate. The PHC Advocate is a network of robust young people that are empowered and motivated to be engaged in primary healthcare strengthening via collaborative multi-sectoral approaches. Bringing people from vast background in education, people from agriculture, social services, and even technology, the media, to advocate for health system strengthening, which is quite foundational to the attainment of universal health coverage. And most of this advocacy is being done by the youth, who understand where the shoe pains them more, because by asking the young people that are mostly affected in terms of unemployment, they are mostly affected in terms of not having the necessary financial resources or the technical know-how to even to provide themselves the basic healthcare services they need. And most of all these people spend through out-of-pocket spending. They constitute a very large portion of the percentage of people that engage in out-of-pocket expenditure. So the youth has to be at the forefront, not just making them part of the team, but make them play an active role from planning to organizing up to the point of implementation in terms of monitoring. At every facet of life, the youth needs to play an important role, considering the number they constitute in the society, which is over 70%. And in most cases, if we are able to make the young people believe in the attainment of universal coverage, they need to own up. They need to take ownership of this initiative. And the only way you can take ownership is to ensure that you get yourself covered under a health insurance. There are quite a number of health insurance bodies. We have the ones provided by government, the one provided by the state. We have private-owned insurance body as well. And also, through one of our advocacy, which is called My Health Sure campaign, like I explained, a sustainable community-centered advocacy, for universal health coverage. What makes this sustainable? Because if you're talking about universal health coverage, it's anchored on the principle of social justice, whereby everybody everywhere have some basic care that they need without undergoing financial difficulty. So while advocating for a grassroots advocacy for universal health coverage, we met a group of persons that say, okay, we don't have the money. All we're concerned about is what to eat in our stomach. How do we ensure these persons that are most disadvantaged are covered under health insurance when the government is not doing enough? And we engage them. Okay, most of all these persons were farmers, local farmers. Okay, what do you have? Some of them have some farm produce. We started talking with some other government agency, some private sector, to see how we could liquidate these farm produce that they have in exchange for a health insurance coverage. And those that don't have any farm produce, okay, is there anything you can do? There's a particular low-cost health insurance company that we work with, in as much as you are able to provide some level of recyclables in your environment. It could be paper, it could be condemned battery, it could be, anything that can be recycled, get us this quantity of these recyclables. We are going to give you a health insurance for 1 year. So because we cannot afford to leave anyone behind just on the basis of the excuse that I don't have the financial resources to provide for myself, and the government has not done much to also cater for such persons. So the approach is quite holistic, and that is why we have launched what we call the PAC Advocate Platform, where we are geared towards empowering 100,000 empowered and motivated young people from vast background that will be involved in different advocacy addressing social determinants of health because of their importance, to healthcare. We have people from education, because the more we advocate for education, the more the health-seeking behavior of the people is increased. And the more we advocate for agriculture, the more the more we try to attain to the issues of food insecurity by ensuring that our population gets the required number of healthy foods to eat. In fact, by even addressing to the point of, planting, ensure that how do you plant? How do you cultivate your crops? What are the chemicals that you shouldn't use on the farm? This is the proper way of harvest, because all these has a negative impact on the entire health of the population. So our approach is holistic, and that is why we're expanding this network, like I've said. In the couple of days, we are going to open up our register for us to onboard more Nigerians into these that will be part of this advocacy. And these persons are scattered around the 774 local governments in Nigeria to be involved in advocacy, because we carried out a research recently and realized that 80% of Nigerians don't even know or have not even heard what UHC is, or don't even understand what universal health coverage is. So based on this, we came up with the conclusion that it's as a result of low advocacy on the part of the government parastatals and some of the civil society organization. We thought the only way out of this is to go beyond just the media. People need to be on the grassroots. people need to talk to. Family members need to talk to family members.
Zachary, for these comments. In the interest of time, I think we are due for the next session. I know we cannot completely finish this discussion today. I would urge us to share some contact details so that we can always reach out and continue this conversation even as we head to the next session. I want to thank all our speakers for engaging us today, as well as the participants for getting time to attend this session. Let me pass this over to Collins as he rolls us over to the next session. See you there, and let's continue having this discussion together. Over.
Yes, thank you so much, Dr. Opon. Ladies and gentlemen, we are very sorry because of interest of time for the next session. We've just cut you short, but we believe this engagement cannot be exhausted today. This is an engagement that will continue, and at the end of it, we'll be able now to identify key roles and key areas that the youth across Africa can play to drive the universal health coverage across. Ladies and gentlemen, for those who have just joined, my name is Collins Dundo. I am the interim CEO for Youth Initiative Development. At this point of time, we are going to the next session, and this is another interesting, and I believe that your contribution will highly be appreciated. And we are going to the session for the youth as a youth-driven immunization advocacy. So that is the role which the youth can do to drive vaccination. So we'll focus on HPV, malaria, and other vaccines. Ladies and gentlemen, at this point, I don't want to exhaust a lot of time. I'll give straight to our moderator of the day, Ms. Lizzie Otae, to take us through. Lizzie, over to you.
Thank you. And I need to highlight that I did cut my hair. I had comments yesterday after moderating, so it's the same person. I just need to emphasize that. Ladies and gentlemen, welcome again. It's day 2. We're almost closing the YIDP Summit, but I'm super excited because it's all focused on youth. So this next session, as Collins just mentioned, we're going to look at youth-led immunization advocacy efforts, and we have key experts who within their own seats and own will are doing something behind vaccines, and especially with the youth. And we want to know what they're doing, how they're promoting youth-led immunization processes. And we're just in the pandemic phase. So we've seen a lot of vaccine hoarding and vaccine hesitancy. And I'm hoping that these are the kind of keywords that are going to come out during our speakers' conversations. But before we kick off, I'm super excited to introduce our keynote speaker. This is Dr. Chris Kaniki. I'm going to avoid the middle name because I'm not so sure how I'm going to butcher it today. So Doc, over to you. But before you kick off, I just want to boast a bit about what Dr. Chris has been up to. So he serves actually as a senior technical officer for strategic programs in the Office of the Director of Africa CDC, and he coordinates the Africa Union COVID-19 vaccination. So people, if you have any questions regarding vaccine hesitancy and hoarding during COVID-19 and the role that, potentially the youth would have played, this is the guy to grill during his presentation. He's a medical doctor by profession, a PhD candidate. Soon enough, we'll be calling you Prof. And he's very passionate about social and public health oriented professionals. So I don't want to blow your trumpet too much because your CV totally speaks for itself. But Chris, if you're on this call, Doc, over to you for your keynote address. Thank you.
Thank you so much, Lizzie, and good afternoon, everyone. Wow, you are just putting it so high, but let me try at least to reach the point where you've put it. First of all, I would like to thank the team organizing this event. It's an honor for me to be part of it and on this panel. But thanking the organizers, like saying that having this kind of a summit organized by young people is to contribute to what public health should look like on the continent is something that we really want to commend and even support more, and make sure that at least every year we have this kind of engagement, and not only, I mean, online, but even pushing for it physically, so that we have enough time to interact and, you know, create this kind of network where we share knowledge and also supporting each other. I really commend the summit and the team, the YIDP team, Collins and Colin. Very huge congratulations to you guys. Let me now try to talk about what Africa CDC and as coordinator, what you are doing when it's come to engaging young people in the field of immunization on the continent. When COVID hits the continent, we all know here that the discussion started before the disease, and then when it started the discussion around vaccination, the vaccination uptake on the continent, it started very slow, and around February at the summit in Addis Ababa, I mean the AU summit, His Excellency President Cyril Ramaphosa, in his capacity as the chair, I mean the champion of COVID-19 on the continent, together with the former Africa CDC Director, Ambassador John Kengasong, who is actually leading PEPFAR, I mean, the Global Health Security, the new Bureau of Health in the US. We discussed and came up with an idea, like, how can you bring young people in this field, like, to advocate for vaccine uptake on the continent? Because we've seen that there was a lot of what has been called at that time hesitancy, or so much information, misinformation, I mean, around COVID-19 on the continent. And then that's how we came up at Africa CDC with what we call the Bingwa Initiative. Bingwa, I mean, for those who are in Kenya, they know it means champion. So it was for us to engage young people as champion when it's come to vaccination. And we started with COVID-19 vaccine in our community. The idea behind COVID-19 Bingo initiatives was to recruit young people in their community, train them, capacitate them, empower them, so that, and deploy them in their community for them to mobilize their community, telling them why it's important for everyone to get vaccinated so that everyone is protected. Because we used to say at Africa CDC, no one is safe until everyone is safe. And that is how the Bingo initiative started. Let me not try to bring it at, I mean, covering all the immunization program, not only COVID. And for even us to understand the role or the importance of having young people on this agenda, let's not forget that Africa is made of 60 to 65% of young people. In this, we say those who are below 25 years old. And for a continent which is made of 65 of its population below 25 years old, any initiative when it's come to public health, if you're not engaging this group of population, you are just preparing yourself to fail. So if you don't want to fail, you need to engage this proportion. Engaging them in, as stakeholder, I mean, agent of change, not only as beneficiary. We don't want this policy or where we look at young people like we want to do this for young people. But we need to look at young people like we want them to be sitting at the same table. We discuss together, come up together with the idea and implement those ideas, because they are also part of those who are going, I mean, largely part of those who are going to be the target of this policy. So we want everyone to be part of this process. And when it comes to immunization, any type of immunization, let's talk about Ebola, HPV, malaria. Let me take an example about malaria. We are talking about malaria. Those are mostly victims of malaria. Most is like under 5 years old. We need young people to be advocating for that. But let's look the other side. Who are mothers of those under 5 years? Most of them are in the bracket of 18 and 30, 35. Let's even say 40. But still we are in that bracket of young people. So if we're looking at mobilizing people or talking about vaccination for malaria, HPV, whatever it is, anytime we find that young people are still the target, when it's come to the age group, they're still our target, either as agent to change, like when you look at nurses or community health worker, again, we still have a large number in that bracket. So if we have young people as agent or target, when it's come to all those issues, when it comes to vaccination, or even promoting this vaccination in the group, why are we not engaging this category of the population? So we need to make sure that they are the one driving this agenda. And this is why at Africa CDC, we said that we need to capacitate young people in the community for them to start championing the vaccination. Immunization program in our program should be championed by young people in a way that we are making sure that we are really preparing to succeed if we don't want to fail, again, as it has been the case for the past decade. We want to change the narrative on the continent, and this can only be changed with young people being part of the process.
Perfect.
Yeah, I was going to stop there. Maybe we discuss a bit.
Yeah, I was about to stop you, but thank you very much. I mean, this is just the beginning of the conversation, and I like the fact that you've mentioned that no one is safe until everyone is safe. And given the fact that majority of people living in especially in the African continent, are youth, we really need to get them on board. So thank you very much, Doc. I know you're still online and you're going to be part of the next panel, so we'll just dive right into it. I've already been given a heads up about time. Ladies and gentlemen, we'll just dive into the whole session and we get to introduce you to our other speakers. And I know I've been given a heads up that the speakers are indeed on call. But now that we've heard from Dr. Chris on, not leaving anybody behind, so to speak, we're going to go to the next session and get our speakers to also chime in to their thoughts and especially what they're doing. So if Valentine, you're there, we're going to start off with you. So what you're going to do is you're just going to take around 3 minutes or maximum 5 if you really have to stretch it. You're going to tell us what you do under your foundation, under your role. And we're talking about vaccines, immunization, and having the youth drive these initiatives. We've seen them being left behind, and we'll take a case study of vaccine hesitancy during COVID-19. So as the CEO and founder of DAE, what are you guys doing to change that notion of what happened during the pandemic? So Valentine, over to you. Just introduce yourself and just dive into the question.
Hi, everyone. My name is Valentina. I am the founder of a gynecological health company that's based in the UK. We've created the world's first diagnostic tampon that enables the at-home detection of HPV, human papillomavirus. And I wanted to share my thoughts about the importance of gynecological health screening in really accessible and affordable ways, namely through a product that many women have used already multiple times in their lifetime, which is the menstrual tampon. So depending on the specific geography, anywhere between 40 and 80% of the female population already use tampons regularly or have at least used tampons once in their life. they has designed a tampon that is quite easy to insert in the vagina without it being invasive. We have an applicator that enables the tampon to reach the cervix, which is where we're able to obtain a sample for HPV detection. And we think that it's incredibly important to increase access to the at-home detection of HPV as a less invasive and more accessible way to screen for cervical cancer, alongside vaccination regimes, which are incredibly important, and part of our mission at DAY is to support access to vaccination regimes. But alongside vaccination, people should continue getting tested regularly for HPV, and being able to do so with a device that's not intimidating and easy to utilize is a great thing. We've seen good success rates in the United Kingdom and Italy. We're now looking to conduct a clinical trial with 150 patients in sub-Saharan Africa. We're speaking with universities in Nigeria, Tanzania. So if you do have any contacts and you wish to be involved in this clinical study on at-home HPV detection, please do reach out. I think I have a few slides. I'm not sure if I should pull them up or if they...
Sorry, just how long are your slides? We were trying to make it as interactive as possible, but if you can work with the remaining time that you have, then that should be okay.
Okay, that's fine then. But yes, so we've, as I mentioned, we've designed a method for the at-home detection of HPV, which we think is an important part of cervical cancer prevention.
Valentine, you can go ahead and share the screen.
I'm happy to not share my screen if we're out of time. I will share my email in the chat. So if anyone wants to reach out with regards to the clinical work that we're doing in testing the sensitivity and specificity of diagnostic tampons for HPV detection, please do reach out. We're very, very interested in supporting these efforts.
Great. And this was just like the introductory so that they do understand who Valentine is and what DAY does. So in the next questions, I'm pretty sure you'll get like some slots to go through your slides, but then we'll dive into getting to hear from the next speaker, who's going to be Vicky Mayo. I'm not so sure whether Vicky is here.
Hi. Lizzie,
hey,
I'm here.
There you are. There you are.
Yeah.
Okay, good. Now, Vicky, Jon Snow, what are you doing in terms of youth-driven immunization advocacy? So introduce yourself. Just give us a bit of a snippet. We want to know what Jon Snow does within this space. And I'm pretty sure more questions will follow up and exactly what those kind of initiatives look like. So over to you.
Yeah, thank you so much, Lizzie. And I'm happy to be here. My name is Vicky Mayo. I work with Jon Snow Inc. I'm actually stationed in Kenya. I support the National Vaccines Program here within Kenya. I'm a senior program officer within Jon Snow. So it's an NGO that has a lot of public health work around the world. So probably I'll just dive directly straight into the area that, or should I wait for you to ask?
No, carry on, because this will give us a more holistic idea of what your organization does and what you do. So carry on.
Okay, so, globally we've been supporting a lot of basically vaccination, right? We have an immunization center and it works in several countries within the world. In my question, I'm actually tackling how youth leaders are able to, basically promoting advocacy within for HPV, and youth leaders, how in the context of promoting HPV and other vaccines, how can the youth leaders collaborate with healthcare providers, educational institutions, community leaders, enabled to design culturally sensitive and inclusive immunization programs. So basically what we're trying to achieve is to reduce basically to increase vaccine literacy among the adolescents and youth, and to promote vaccine confidence and uptake. And definitely the overall objective is to have inclusive immunization programs that are able to cater for our adolescents and youth. And why are we doing this? Is because we are experiencing some inequitable vaccination coverage in terms of, I mean, whether it's COVID, whether it's HPV, even malaria, though in Kenya it's just in a few counties. The coverage is not, equitable in all areas. So also adolescent views have been underrepresented in terms of what they want, in terms of how the services should be delivered to them. There's also limited understanding of vaccines within this cohort, and then insufficient. So when we move to schools, there's insufficient information in schools that hinders decision-making. Basically, the information that is being given out is maybe not as much or comprehensive for the students to be able to understand vaccinations. And then the students, the youth and adolescents and youth are actually getting information from traditional and social media, and this information might not be very comprehensive and, give the true picture. And also they rely heavily on their parents to be able to get consent. So the concept is actually to have a people-centered immunization service delivery experience, whereby this experience is actually includes components from the individual, community, facility, and system level. And this contributes to, whether or not a client has a positive or a people-centered, high-quality immunization experience. The aim is definitely to have, these services be people-centered and designed by the adolescents so that it caters for their needs, as well as their caregivers and the health workers and the community at large. So what can the youth leaders do in terms of what is their role, to play in the society, so that, we can, they can have these services actually designed with them, with the youth in mind, so that, we can increase the uptake of the vaccines. With the healthcare providers, one of the things that the youth can do is actually, number one, get vaccinated. And by getting vaccinated, you become a youth, an immunization champion and an advocate for HPV. So basically, if it's HPV, you're advocating for the vaccine, you're advocating for other behaviors, other components or activities that can actually improve the uptake or reduce the youth's risk of getting infection and actually getting cervical cancer in future. And also the youth leaders also have to build their own capacity. They need to get the knowledge on the vaccine with preventable illnesses, as well as the vaccines that can actually be used to prevent these infections. They need to engage healthcare workers, especially in Kenya. We have different levels of health coordination. We have the community level, we have the health facility level, we have the sub-county level, county and national level. So the youth leaders have to be involved in each of these levels. And this way you're able to, be able to put in your voice in terms of when policy is being made and guidelines are being developed, when services are being designed, so that you can give your input in these areas. They also need to be involved in education institutions. Basically, within the area that youths are working, you need to find out which educational institutions are there, and also find out which activities and events the schools have, whether it's sports or arts, drama and music. And this is a way to have advocacy and engage with the peers that are consumers of these commodities. As well, the youth also need to collaborate with the school health club focal persons. Well, in Kenya we have school health clubs within the schools. And so this would be the right person for these youth leaders to engage with, so that they can be able to plug in and be able to, have some advocacy and engagement with them. Also, of course, actively engage with the Ministry of Education, and the Teachers Service Commission in Kenya is also important, especially for HPV. In the community, we have joint health collaboration networks, which these networks include.
If you can just summarize it, because it's the first round of questions.
Okay. Okay, 1 second. So yeah, we in the community, we also have many areas in which the youth can actually engage in terms of so that they can just plug in and know what the community wants, especially the youth. And all these activities will be able to inform and enable the youth leaders to be able to have, within the minds to design immunization programs that actually include the adolescents and youth. Thank you.
Thank you very much. And I like the fact that, Valentina started us off with innovations and what they have around the HPV in regards to the tampons. And you've brought in the aspect of promoting HPV advocacy, but I'm pretty sure there are a lot of challenges that you've encountered only with so I'll just pick HPV for now, only to bring in Nasur so that you can give us an input of all these challenges that we're facing when it comes to vaccine hesitancy. What are the key lessons under Jon Snow that you've actually picked up? Maybe it's something that we did not use during COVID, but there is a vaccine hesitancy, and vaccines have been there for quite some time. It's not the first time people are getting vaccines because of COVID. When you get born, you get immunized. There's some vaccines that you get and nobody has been questioning, but now we have a vaccine hesitancy. People are questioning the COVID-19 vaccines, HPV vaccine, even the malaria vaccine that's now being rolled out across different countries. What are your inputs on that, Nasur?
Yeah, thank you, Lizzie. My name is Nasur Mohammed. I'm a senior immunization technical advisor working with JSI headquarters. I'm supporting multiple countries in Africa, but I've also been involved at global and regional level for vaccines. So as Vicky said initially, basically JSI is supporting many countries in the world to strengthen routine immunization, as well as introduction of new vaccines, including HPV. So going back to the question, as many initial speaker speaks about the importance of youth, but also given that the majority of our population in Africa is youth, so it's very important to look at the vaccines in the youth perspective, especially the issue of hesitancy. So to me, what's need to be done is to make sure that youth are empowered with enough and correct information, because sometimes they might have partial information, correct but partial, and then when they go to the community, they face some questions from the communities. And then instead of them educating the community, they end up being convinced that the vaccines are not a good idea. So with respect to HPV, for example, we know it's given to adolescents. But we should not limit ourselves to HPV vaccines or vaccines that are given to youth, because we need youth to be the leaders in terms of advocacy for vaccines and making sure that we are dealing with the hesitancy. We know now in this world, social medias, the message when it goes to the social media, it can go around very quickly. And the main users of these social medias are youth. And therefore, it's very important to make sure that we have youth advocating for vaccines, not necessarily the vaccines that are given to youth, but all vaccines, since we are talking about the vaccines. So it's important for youth to be well empowered, to have correct and comprehensive information regarding to every vaccines, so that they can play a roles in terms of advocating for the vaccines. So to me, empowering can be either done by experts, making sure that they reach out to different forums where youth can be reached, but also youth themselves need to make sure that they know where to get the correct information. They have to take initiatives by themselves to make sure that they always have correct and comprehensive information when it comes to vaccines, since this is one of the most effective public health interventions to fight against many vaccine preventable diseases. So let me end here for now and then.
Definitely. And thank you very much. I like the fact that you just touched on digital space, and that was actually the next speaker's niche area of discussion today. And what I like is we were talking about sexual reproductive health, and we were urged to be a bit open-minded. We're moving to the digital culture and we need to address things differently. So Dr. Kapil, the way Nasura just mentioned that we need to give the youth enough and correct data. And we know where they are. Most of the majority of youth are on the digital spaces, they're on social media, and this is where they share information. And we have social media influencers, which really, the minute they say something, it runs like wildfire. So what are your thoughts around vaccines, vaccine hesitancy? I mean, anything to do with immunization in the digital space? Over to you, Dr. Kapil. I'm hoping Dr. Kapil is in. Collins, is Dr. Kapil in, or we can just move on?
It was in, he has just dropped.
He just dropped off. No worries. This question can actually trickle back to other speakers. We'll just circle back to that when it comes back in. But now that we're talking about innovations within the health space, especially when it comes to vaccine hesitancy, but we also saw during the COVID-19 pandemic of vaccine hoarding, and it's still an issue which is publicly being discussed around other platforms where development partners are being seated. And the issue was when we needed the vaccines, we could not get it. So we're talking about not only hesitancy, but why are we talking about vaccines that are not available? But we do know there's some innovations around this kind of space. And I'd like to bring in Barak from Africa Alliance. And Barak, if you're here, just unmute yourself. We're trying to see how accessibility of vaccines in Africa can be made a reality. And this is taking from lessons learned from COVID-19, vaccine hoarding, etc. Over to you on how we can learn from what happened. Over to you, Barak. There you are. Thank you.
Hi, Lizzie, and hi, colleagues. Thank you for this invitation. I don't know if I have the chance to introduce myself.
Please introduce yourself. Give us a background of what your organization does within the health space. How the youth are involved. Please tackle the question. Sorry.
Awesome. Thank you so much. Yeah, so my name is Barak Owino Ogwell from the African Alliance, leading the sub-grantees work under the People's Vaccine Alliance of Africa. We have our headquarters in Johannesburg, but also around the country, the 5 regions in Africa. I'm currently in Nairobi, where we have also one of our headquarters. So in a nutshell, the African Alliance is a queer-led organization focused on health rights, basically in the space of public health. Initially, we started off as HIV prevention, but over time, we have grown to further engage in as the epidemiological transition takes place, as the different health challenges evolve. We are also evolving with the same as an alliance. So over the years, we, especially during the COVID-19 pandemic period, we have had a lot of advocacy work, a lot of campaigns in terms of access to medicine, access to vaccines, access to treatments. And by that, we were honored to be the Secretariat for the People's Vaccine Alliance, which is a movement of former heads of states, Nobel laureates. So we have activists across the globe who came together back in 2020 when the vaccines were being introduced, to ask for a people's vaccine at the time when there was a lot of hoarding by the Western countries. There was a lot of price hike, the pharmaceuticals refusing to share the technology and all that, despite the fact that Africans had the funds to purchase these vaccines. So from there, we've been really engaging the different players at the same time ensuring that there's accountability even within our governments, the governments in Africa. And then by far, there was an opportunity to engage in the decolonization work. So that is where now we dig in further to fund some African-led CSOs that would not have otherwise received funding because of the structure of funding that exists globally. So then out of that, we have had an opportunity to work with different organizations that are working within the COVID-19 space, supporting them in their different advocacies. So these organizations serve different population, and most importantly are the youth. On like 90% of the organizations we have served, majority of the populations that they serve are under 35 years of age, which is very, very crucial at this moment in our continent, where we're experiencing a lot of change. We're experiencing a lot of youth bulge who need the different interventions in terms of health. So in our work, like I mentioned earlier, especially on the decolonization bit, the core of the system is ensuring that the funding that we have, promotes innovation. Like one of the sub-grantees that we do, we support, who is actually in Liberia, does a lot of work in they call it the open web system, where they give out information to the populations, especially the youth, because the youth are tech savvy. So the web platforms, utilization of WhatsApp. So at any point where information is needed, then they can be able to get this information from these platforms. And then the continuous engagement with the youth. They hold weekly information sessions with the youth. They hold radio talk shows where they invite the different stakeholders in the field to come and speak, give information about the vaccination bit, because we know we have had the challenge, especially during the COVID-19 period. There was a lot of the infodemics was there. From there, then we had the mis and disinformation that really confused a lot of people. And the way we know, like, bad news spreads very fast. So the moment there is an anti-vaccination, politics and all that, it comes to, the youth get a lot of this information very fast. So it is crucial that when we are giving out this information, the information is actually accurate. These people work within the community, so they are trusted. They are influencers within the community. So they have had played a very vital role in ensuring that this information goes out to the community. The engagement part of it, when we are doing during the clinical trials, especially for the vaccine, the African Alliance really rooted for the engagement, even with people living with HIV, to ensure that everyone is brought on board in this, journey towards addressing the pandemic. So that has been our work. So the core of it all is ensuring that the different marginalized communities are engaged, and we form the solidarity with the Access to Medicines movement, which we know by far started way back when there was the introduction, when we were dealing with HIV, a pandemic, when PrEP was being introduced, the trials were going on. So in solidarity with that movement, we took that same campaigns, especially to within the global health space, and we have had a lot of aggressive campaigns against big pharma, so that we can have that technology shared with the African continent. I know there is the mRNA hub in South Africa, which is picking shape, and the spokes around the continent as well. But HPV is still expensive in some countries. Recently, I just read the news that for Kenya, in 2020, by 2027, Gavi will be pulling out of funding HPV vaccination in Kenya. And for right now, it is actually free of charge to girls between the age of 10 and 14 years. So by then, it will rise by like over $140, which is expensive for a regular, household to really afford. And I get it there. Malaria vaccine was just introduced recently in Kenya. These are funds that are being supported by Gavi. So once they pull out, if we have mechanisms in place, if we have these hubs that can be able to engage in further research and ensure that there is production, we can have the vaccines for free of charge by the people, for the people. So that is what we stand for. And we hope that we'll all be in solidarity with this movement. And this is actually a step ahead in continuing this conversation, because then it provides that safe space for us to speak out our minds, for us to really engage experts in the field and share ideas for moving the health, global health in the region forward. Back to you, Lizzie.
Thanks, Barak. And I like the key terms you've been using, and it all comes down to making it more sustainable. We're talking about vaccines. We need to make sure these vaccines are available for the youth. If we want them to help in advocacy, we need to talk about something that's readily available. And Chris, I'll just bring you back into the picture because I'm trying to save the discussion from Catherine Mwaniki as the last. You know how protocol is, and she's from Nairobi City County, so that will be interesting for her to give us a public sector point of view. But Chris, I know you're still on the call. We're talking about decolonization. We're talking about ensuring that these vaccines will be available for the next generation. And as Barak has just mentioned, that in the next coming years, Gavi is going to pull out. So what are we doing from an African Union perspective? How are we going to make sure that these vaccines are available? These are crucial and mainly needed vaccine for the youth. How are we going to make sure they're going to be there? So over to you, Chris, just to give us your insight. You're on mute, Chris, but I can tell you're still here.
Hello, can you hear me?
Yes, I can hear you now. Good.
Sorry, Lizzie, can you please repeat the question? My line was breaking.
No worries, it's okay. So we just got a presentation from Barak, and the discussions are around decolonizing the whole vaccine notion. We need to produce locally for Africans by Africans, and that's actually the Africa Alliance, main theme. So what is happening from an African Union perspective? How are we going to make sure that crucial vaccines like HPV are made available for the upcoming, generation, if in case Gavi pulls out and the funding actually ends?
Thank you so much for the question. And I'm very delighted first to hear my predecessor, Barak, Vicky, Nassau, and others. Very good insight. And I'm very happy. Thank you for your contribution. Let me remind this. The point of Africa Union or Africa CDC, when COVID-19, we all start the discussion from what COVID taught us. Only 1%, please take care for the figures I'm giving you. Only 1% of the vaccine that we're using on the continent are manufactured on the continent. And we are the biggest continent consuming these vaccines. And the vision of Africa CDC, as I say, from COVID, during the pandemic, we developed a vision, what we call the PAVM, Partnership for Africa Vaccine Manufacturing on the continent. And this is the flagship program that the director of Africa CDC is pushing for us to be able to secure our health on the continent. This initiative is aimed to make sure that by 2040, we have to move from this 1% to at least 60% of vaccine that we are using on the continent. Just yesterday in South Africa, the Director General of Africa CDC, Dr. John Kaseya, has handed over some equipment to the national organization that to support them in this way of moving this agenda forward. Before COVID-19 hit the continent, mainly it was just two countries, maybe Senegal and South Africa, as two countries on the continent, we've seen that we have this project of manufacturing vaccine on the continent. But from 2020 to up to now, we've seen this movement going forward. We have actually more than 6 to 7 countries going in that direction to make sure that we are producing vaccine. But the discussion as of now is to make sure that we are not all of us going to produce the same vaccine. As we are talking here, we're talking about vaccine for COVID-19, HPV, malaria, Ebola, and we have so many infectious diseases. We have to come together and discuss and say, okay, this is the pool, the country that is going to produce this vaccine. But also the discussion is to make sure that we are securing also the market for these vaccines. We have a lot of issue on the continent where a country can be producing something, but other countries, instead of buying from that country, they will go still buy outside. But how are we promoting the production on the continent if we're doing that? Because I cannot be producing something that I'm not going to sell, so it's a waste. So we need to also, we are having that discussion where we're pushing for production on the continent, but at the same time, we need to bring everyone at the table to discuss. Like, this is our agenda, and everyone has to contribute with idea and a suggestion. Like, I'm be producing this, but we need to secure the market as well.
Okay, great. Thank you. Insights, yes, highly appreciated. Ladies and gentlemen, we're talking about youth-driven immunization advocacy, and we're promoting vaccines and immunization from aspects of HPV, malaria. In Kenya, there's a national outreach when we're being given cholera vaccines now. And we're just going to talk about, and thank you, Chris, for just summarizing that we need to also trust when we talk about Barack for Africans, by Africans. If we're making it, let us also consume it. But we'll just take a bit of a shift and go to Dr. Kapil Narain. I've been told you're in. Doc, we were talking about social media, digital age, and how we can use, the vast amount of youth who are using digital spaces now to help in advocating for vaccines. And now that we have a wide outreach for HPV vaccines to be taken, and we're trying to also see, a lot of countries, they're trying to also see whether COVID-19 vaccine can also be part of the primary healthcare. So when you go to a hospital, this is part of one of the vaccines that you get. So Dr. Kapil, in your own opinion, given the fact that there's already a digital divide between the rural and the urban youth, how can we bridge that gap? And how can we make sure that we give them the right and correct information while they're on social media? And also just how can we tap into social media influencers? I mean, the youth are there and looks like they have a vast following, and we can use that to an advantage when it comes to immunization. So Dr. Kapil, if you can introduce yourself, tell us what you do under One Youth World, and then tackle the question, that will be good. Over to you.
Thanks very much, Lizzie. I hope I'm audible. Essentially, yes, so I'm working I'm Dr. Kapil Narain. I'm working as a community service medical officer in a rural part of my country in South Africa, and I've been involved in various initiatives. I'm also, due to my efforts, an ambassador for One Young World. I was also involved in the African Youth Front on coronavirus, which was an initiative by the AU and Africa CDC. And as well as driving as one of the co-leads of Vax Time, an initiative where we initially wanted the youth to drive vaccine promotion. We wanted to call an end to vaccine inequity, and we called for the youth to submit videos via Twitter and to share and challenge one another to create promotion for vaccines during the time of COVID-19, when it was at its peak and when we saw a lot of challenges with vaccines. With people uptaking it, young people uptaking vaccines, with challenges with hesitancy, as well as the inequity that we've seen across many African countries. Essentially, just to answer your question, I think that social media plays a pivotal role in health promotion in general. And I think there's a double-edged sword here, in the sense that we see that now more than ever, the amount of content that's being generated is at such a fast pace that there's just this ocean of misinformation and disinformation. And we know that during the time of COVID-19, it was so high that it actually prompted the World Health Organization, the WHO, to call upon their first meeting on infodemiology, first conference on that, where we could then dissect these issues. And I think on one hand, whilst we have the sea of misinformation, therein exists also an opportunity to harness social media as powerful tools to promote vaccine, uptake. And I think looking at some of the challenges that we have with the youth uptaking vaccines, we need to look at the opportunities there, at looking at really getting on board influencers, starting agreements between, whether it's partnerships between governments and influencers, governments and NGOs, to try and get the message out there, whether it's on, you see, YouTube, Twitter, TikTok is very big, and Instagram, etc., on how we can actually make health promotion attractive and get the youth on board and get communities on board. The challenges are there also that some communities, however, may not have access to mobile data or internet activity, and therein looks at the role of certain organizations that partnering with telecommunications networks, with companies, in order to make certain channels, certain platforms zero rated and data free. So I think there's a lot of misinformation that can be out there, but there's a lot of opportunity to tap into on how we can really improve access and initiatives, and how we can really get the drive, especially amongst the youth, involved in getting excited about healthcare and promoting this amongst their communities. Yeah.
Yeah, and I totally agree with you. I mean, of course, social media is double-edged, and I like the fact that you brought up the angle of partnership, because that is what is directing me back to the JSI team. I was hoping that we would get I was hoping that we would get the Nairobi County lady on the call, but she's not here yet. So what I'll do is I'll go back. You're here.
I'm acting on her behalf. It's Anne Boraya.
And perfect. Okay, great. Because I want to talk about PPPs and how we can use PPPs when it comes to youth-led immunization efforts to actually make uptake of immunization a reality. Because you know very well, as mentioned by Chris, it's only 1% of the vaccines that we actually use that are being manufactured in the continent. But Africa itself, for now, globally, we have 1.8 billion youth and adolescents. And these are people who can actually influence each other. And this was something that was missing during COVID-19. So from your own perspective, how can we bring in the angle of PPP in ensuring that crucial immunization and vaccines are taken by using the power of, the word of mouth and this influential social media guru that the youth actually are using? Over to you, so that you can give us from a public lens what your thoughts are around that. And you can introduce yourself, and thank you very much for covering in. Over to you.
Okay, thank you so much. My name is Anne Boraya. I'm a nurse working in the immunization program. Apparently, I'm taking care of the vaccine and also fully participated in COVID-19 vaccination at Mbagathi Hospital. If all you can remember the queues there and everything. So when it comes to the PPPs and the vaccines, we really want to involve the people. That is people-centered. We ensure that the vaccines are equitable. The vaccines are sent across the same way up to the primary level, so that when we are delivering the vaccine services, it will be the people context, so that they know this is the type of vaccine we want, and we were involved also in the management and planning for the vaccination. And then we need to have a national, county, and community ownership, in that, as we all know, immunization is key in achieving universal health coverage in Kenya. So unvaccinated groups, that they make markers of underserved communities and can direct primary healthcare services to the unreached community. So we need to have strategies that can foster collaboration between the national, county immunization program and all the private sectors, so that we get high quality immunization
I'm not sure if it we lost you for a split second, and I think it has to be the connectivity issue. I don't know whether you can try and come back.
While maximizing the available resources that we have.
Oh, I could tell the last remarks were powerful, but we're having technical glitches. I don't know whether Collins, you can try and mute her, and we can roll her back in later on. But just to go back to the JSI team, and I'm trying to look at this. Oh yeah. No, unfortunately, it's your connection. It's you're breaking up quite a bit. So I would advise, and if you can just log out and log back in, it might be a bit stronger. Ladies and gentlemen, we have 6 minutes. We're still talking about youth-driven immunization. If you do have any question or concern or comment, please, I will allow you to, unmute and ask a question. I'm trying to also keep tabs on the chats, and I can see amazing comments, and I'm hoping the team is also looking at that. But Jon Snow Inc., I just want to go back to you guys. We're talking about PPPs and how they can actually help in promoting advocacy of immunization and vaccines from the youth lens. And I'm pretty sure there are a lot of challenges you've bumped into, especially with HPV vaccines. And just a key fact from WHO, HPV vaccine coverage continues to increase in lower countries. In 2019, the proportion of adolescent girls receiving both doses of the HPV vaccine, which protects against cervical cancer, stood at 7% in lower income countries, but it increased to 10% in 2022. So there's something we're doing right. And I needed you to give us the inside scope from a private sector lens. What is this thing we're doing right that we've moved from 7% to 10%? And how can we target the 90% population that we've left behind? I think I'll start off with Vicky, and then Nasuru can take it over after Vicky comments.
Thank you, Lizzie. So briefly from my experience, I know what has happened is that there's been a lot of advocacy. And actually, not specifically PPP, but I know the government has really, strengthened this, especially HPV vaccination. There's been a lot of stakeholder involvement and engagement, especially with the Ministry of Education, with the Teacher Service Commission, with the Parents Association. There was a disconnect because actually, even if the major service delivery area within the country is at the health facility, we know that the outreaches going to the schools actually make a very big difference. And definitely for the government to be able to work with this, they have had to work with their partners to be able to send out the teams out to the schools. And this has been very, like a focused thing. We introduced HPV in 2019. However, COVID came and we introduced HPV to the 10-year-olds only. COVID came in 2020, which had the schools closing. So these efforts got messed up. So in 2021, what the government did is that it added the cohort for the age that can be vaccinated to between 10 and 14, so that we can do a catch up to the ones that got lost during the COVID pandemic. And so definitely this increased the target, but then again, Kenya really did well in terms of maintaining vaccination during the COVID period. But then, as you said, we have serious and strong partnerships with between the government, the Ministry of Health, the Ministry of Education, and the partners. Thank you.
And I like the way you've also brought, we tend to see PPPs, and when we're asked about success stories, we don't have a lot, but things are actually working, especially from the public sector lens. So Nasur, over to you. And now that we have 2 minutes, while you're commenting or adding to what Vicky mentioned, you do conclude with your parting shots so that we can do a round of parting shots. Over to you, Nasur.
Yeah, thank you. So yeah, talking about partnership, this is something that we didn't do well. We have to acknowledge that, especially talking about the private partnership, because we are talking about the partnership with the Ministry of Education. It's still a public entity, but looking at the private partnership, that needs to be like sort of analysis to identify who are the key partners that we need to collaborate with. And when we talk about the partnership, it's not only about the partnership of providing the vaccination, but we are talking about the youth who are going to, I mean, we want youth to advocate for the vaccines, for the HPV vaccinations. We have several forums that we can engage with youth. So what are the partnerships that are currently in place that involve youth organization, youth forums, and others? But also looking at what is needed, what are the challenges within the vaccinations, HPV and the overall vaccination broadly. Are there any other partners that we can engage with to help us in resolving some of those challenges? I think those are the key issues that we need to look at, and then do the mapping of the partners and see which partners we need to engage on what areas, and then look forward on how we can work together as public and private partnership. So this is broader areas that needs to be looked at, not only in perspective of just providing the vaccinations, like the outreach services at the schools or the services at the health facility, but rather the broader support for the immunization program. Let me end here.
Perfect. Thank you very much. So I'll take it back to, I know Valentine dropped off. Kapil, if you can just do your parting shots, then we'll hand it over to Barak. And I know Barak, it will be good also while you're doing your parting shot to mention all these other initiatives like the Pots to Arms that you're working on. And then of course, we'll give it to Dr. Chris, who started off the session, to conclude. So Kapil, over to you, and then we can go to Barak. 1 minute parting shots, because we're already out of time. So Kapil, over to you. I'm not so sure. I can tell Kapil is still on the call.
Hello.
Yeah, we can hear you now.
Hi. Okay,
Hi.
great. Yeah, so I think that with any public health or global health initiative, there's a lot of actors, and often we may find ourselves working in silos. So I think collaboration is key, and working together, we can achieve so much more. It does sound a bit generic, but it's so true, and it's so important that we have all stakeholders working together. And I think one of the important things is that of inclusivity and of community and grassroots engagement. And I'd leave you with a quote that we often talk about in many of the initiatives that I've been working with, and that is, there's nothing for us without us. Thank you.
Perfect. Thank you very much. And I know it does sound generic, but collaboration is key, and it has to be done right. Barak, over to you. 1 minute, please.
Yeah, thanks, Lizzie. A very engaging discussion. Loving it. So from my end, I think for any youth-driven immunization campaign to be successful, I echo the other comrades who have mentioned about, the collaboration, engaging them right from the planning, decision-making, and then utilizing those innovative communication strategies, because, those are the key elements that address the specific barriers of the vaccination uptake, and then basically providing comprehensive education on these vaccines is very important. Then I also like to talk about one of the projects that we are doing, which is Pots to Arms, which basically is a community-powered tool that ensures that all the vaccines that arrive at the different ports that we have really reaches out to those who need them most. In between there, where there are a lot of barriers that take place preventing this vaccination from reaching the people. One of them, in terms of information gaps that are existing, So from the lessons that you have had over the years, we know that the importance, the important role that local stakeholders play, especially in terms of accessibility, ensuring that, there is that continuous monitoring, there's that continuous tracking of the vaccines, so that we can have all the people who are required to vaccinate to get actually vaccinated. And then circling back to the HPV vaccine, I know I've worked in a previous project with JSI, we worked with the Ministry of Health, and we know that the community health promoters play a very important role in ensuring that, the information reaches out to the different communities that we have. So basically, building the capacity of these community health promoters, because yes, they're aware of the other immunizations within the routine immunization schedule, but then looking at the HPV vaccine, the key messages that we drive out has been very successful in the past, knowing that this is is really cervical cancer prevention, and then educating also the healthcare workers how to communicate to the parents, how to communicate even to the girls, to the teachers, is very crucial, because at times, there's a lot of scientific language, there's a lot of scientific jargon that goes into these communications that are really supposed to be understood by the layman. Like my mentor always says, explain it like you explain to a 5-year-old. So when they get this understanding, the cultural sensitivities also that describes the Africans in all our diversity, ensuring that also these are put into consideration, so that at the end of the day, we don't talk about vaccine hesitancy amongst the youth, whereas the youth were not put on the table when these decisions were made. They were just brought on the table now when we realize that, there is a population, there's a section that we missed out. So right from the start, having them there, making those decisions, letting them drive this agenda, I think we'll have a very successful initiative driven by the youth in Africa.
Thank you, Barak. I know how passionate you get. If I have to keep quiet, you'll take another 1 hour, and that's a whole panel. But ladies and gentlemen, I need to apologize in advance. We were supposed to do Q&A, but it was a full panel, so a bit difficult to do that. Ezaye, I'll just ask Collins if it's okay to pick one question. But in the meantime, Chris, if you can conclude the session for us, parting 1 minute. I need to reiterate. Oh, okay. Sorry, Chris, 1 minute. Ezaye, is it a comment or is it a question?
Bonjour. Oui, je m'appelle Ezaye Mbumba. Je suis de la République démocratique du Congo. Je ne sais pas s'il y a quelqu'un qui peut m'interpréter.
Ezaye, my apologies. My apologies. The session is being run 100% in English. I don't know whether your English is good or...
Il n'y a personne qui parle français, parce que je pense qu'il pouvait y avoir quelqu'un qui allait nous interpréter parce que...
My apologies. So I think I'll just stop you. Sorry about that. This was something that was supposed to be communicated earlier on. But Chris, over to you to give us a parting shot. Yes.
Prochainement.
Yes.
May we please allow Ezaye to ask his question? I'm a bilingual.
Can you translate, Chris? I'm just asking if there's somebody who can translate.
Ezaye, listen.
Perfect. Ezaye, carry on. You're on mute. Sorry. Unmute yourself.
Merci beaucoup. Je disais que je suis Ezaye Mbumba de la République démocratique du Congo. Je suis à Goma, au Nord Kivu. Comme vous le savez, on est en train peut-être de parler par rapport à la vaccination, mais chez nous, comme vous le savez, il y a autant d'enfants qui sont dans des cas de déplacés. Il n'y a pas moyen qu'on puisse accéder à ces enfants parce qu'il y a des hostilités entre les belligérants qui sont en train de combattre les gouvernements. C'est ainsi que je voulais essayer de vous dire que nous voulons qu'il y ait l'implication de tout le monde pour que ces enfants qui sont dans des cas de déplacés aussi, ils ont besoin d'être vaccinés parce que aussi, on dit les enfants sont l'avenir de demain. Merci beaucoup. Voilà ce qui était ma préoccupation.
Merci. The only thing I got is he's from DRC, from the Goma district. That's how bad it is for me. So Chris, over to you.
It's very bad, Lizzie. I think we need some French next time in Nairobi.
Oh là là, il n'y a pas personne qui allait m'interpréter.
Non, je vais
Dommage.
Isaïe, il n'y a pas de souci. Je vais le
Ok,
faire.
essayez d'interpréter parce que les autres doivent attendre les messages que j'ai vus.
No, ça va. It was
Okay.
just making a point on to also raise the issue of kids, those who are in kind of misplaced, you know, like when he was taking the example of DRC where there is like some kind of war and people have to be displaced, and those kind of refugees, we still have young people and even the under 5. This is why we're even talking about the under 5 who are still not immunized. So we need also to advocate for those kind of group of people to be vaccinated. And yes, as at Africa CDC, we are really looking at that and supporting, coming together with partners to support vaccination in those areas. So Lizzie, the request was for me to maybe coming up with a conclusion.
Yes.
I think a colleague have said it so well and in very different ways. I'm very impressed of this panel. Maybe I'll end with a point at the end of my talk. So bringing together or trying to contribute, if you want, as I said at the beginning, if you want any initiative or program to succeed, we need young people to be driving the agenda. And as someone just said it, driving the agenda doesn't mean doing everything and then come at the end to say, young people, this is what you have to do. No, we need to start from the beginning, the inception, thinking together, coming up together with strategy and how we are going to implement. When it's come to vaccination, I mean, the immunization program in global, we need to make sure that the information, the way we're packaging the information, and I think Barack said it well, we need to bring the information at the level of everyone need to understand what exactly it is. We need to come out of our comfort offices, not because like, for example, what we're discussing now, I will not be discussing using the same word if I have to go and talk to this grandma in my village. So we need to bring down the information so that we are breaking this misinformation of hesitancy. I know I somehow always doubt about what we so-called hesitancy when it comes to vaccination. Sorry to say that. Why? I was in Zambia last year in November. We're doing what we call activation. Some of the young people or other people, like, it's not that they were hesitating to get vaccinated, but some people saw like the fear of needles or not having time to go and get vaccinated. That's why we needed to bring vaccination close to the population. Especially in Africa, the problem is bringing the vaccination close to the population, bringing the right information and passing the message. That's how we've seen people taking vaccination and what our young people are, what you call the Bingwas in Eastern region and Southern region, they're doing, and actually we can see that people are really getting vaccinated. But let me say this, we used to say that COVID taught us so many lessons. And I've said this again at a conference, the VAN conference, Vaccine Acceptance and Research Network. For me, we have only 2 lessons. The first one is we haven't learned anything. Yes, I know, very provocative. And the second one is there is a lot of lessons that we have to learn, but very importantly, we need to implement this lesson to make sure that we are preparing for the next pandemic. Because the truth is there will be a next pandemic, even if it's not our generation, 10 years, 50 years, or even a century after. But we need to start preparing that now to make sure that those who are coming after us, they'll find a system in place that we allow them to tackle that issue when it's coming to them. The first one pandemic, like years ago, it killed a lot. COVID did what it did, but let's not wait for another pandemic come and kill more people. we need to start preparing this. And this is what we're talking about, the PPPR, pandemic preparedness, prevention and response. And this is a discussion that is going on at a global level. But we also need to make sure that as young people, we need to go there, discuss and let them know this is what us as young people we want to do to drive this agenda. Let me end by also just one word.
Thank you, Doc.
No,
Totally
I just want to
appreciate it.
put this message. We're organizing, Africa CDC is organizing a very large conference in November in Zambia. And also, as young, the youth program at Africa CDC, we're also organizing the pre-conference and the merging of this conference. And I'm looking forward to see young people also attending this conference. I know some of them here, maybe they've applied or those will be attending online. But I'm maybe looking at the panel here, we keep in touch and see how we can discuss on bringing us together again to discuss this issue at the Africa CDC Youth Pre-Conference.
And I like that. I was going to ask you about it. This is a CPHIA. This is is it the second one of its kind, yeah?
The third one, but the Africa Youth Pre-Conference will be the second one.
Okay, perfect. No worries. Appreciate it. And yes, Barak, Valentina, Vicky, this is a good opportunity because I've seen they also have a lot of side events. And I'm pretty sure Jon Snow has been part of the other two. So yes, definitely this would be something that the team needs to look into. I'm so sorry, ladies and gentlemen. I need to hand it over. We've actually used more than 15 minutes overtime. Collins, Robinson, my apologies, but I will hand it over to you now. And thank you very much for just allowing us to, still 15 minutes more. Appreciate it. Over to you guys. And thank you, panelists. Thank you, speakers. Really appreciate it.
Okay, thank you very much, Liz, your time. Thank you very much, all the panelists. And also thank you very much, all our delegates. Now, at this juncture, I want to just run a very short process. I just want to thank those who have coordinated this whole process from yesterday to today. I want to thank all our sponsors. I want to thank all our delegates. I want to thank all our panelists. And I also want to thank all our moderators. Not forgetting thanking the technical team that was working behind the scenes. I've been your MC for the day, Kavis Kaumba, but I'm also the Communications and Marketing Director at Youth Initiative Development Program. So I know that things that you are supposed to be just shown briefly. I don't want to take a lot of time, just want to do that. Then now I want to welcome Colin Salandundo to usher us into the next phase, which is not going to take a lot of time. Colin's up to you.
Thank you so much, Robinson. And ladies and gentlemen, let me take this as an opportunity to thank all the panelists who have participated in the entire session. We really appreciate the discussion that we had. They are very useful and insightful. And I would like to say this is not like the end of the conversation. And I like the fact Chris is coming in. And now there is a lot of collaboration that we can build together in ensuring that we are ready because like you've said, it is true that we need to be ready. We do not know when the pandemic can hit us again, but we need to be prepared. And how can we do this? We cannot manage to achieve this if we have youth left behind. And starting from all sector of life. So this is driven towards building sustainable, healthy community. So I'll not take a lot of time, and I'm looking forward YIDP attending at the pre-conference, and I'll be glad to meet the team and also deliberate and have a dialogue on some of the useful discussions that can help build a healthy community, because our focus is to reach grassroots level. And the only way you can manage to reach grassroots is when you have the youth with you. And these are the people who are energetic. These are the people who are affected. And if their well-being and their health is well taken care of, then they'll manage to take care of the vision that we all dream of. Because every one of us is dreaming of a future where technology is everything, a future where our life is a priority, a future where education, regardless of where you come from, you can acquire quality and affordable education. So at this time, ladies and gentlemen, we'll have several discussions and we'll have several communications coming, and our focus as we are walking this journey is unlocking the potential of PPs and technology to revolutionize mental health crisis among the youth, adolescents, and youth in Africa. And we are also venturing in an aspect of whereby we can help the youth and overcome some of the fear, like the discussion we had, some of the youth fear needles because lack of information. We'll love to disseminate this information to the youth, taking advantage of the technology and taking advantage on a one-to-one and different sectors that we have within our community. So ladies and gentlemen, at this point of time, I know some of we are tired, and over 2 days, it's been intense back and forth. But I would like to take this moment to invite Sister Alice Anzoyo from Tangaza University to give a closing remark, but we are going to reach out to you as soon as possible so that we can be accountable of everything that we have discussed here. It's not ending here. We will ensure that we elevate it to a level whereby we'll be able now to have a larger group of energized and empowered and healthy community. Over to you, Sister Alice Anzoyo.
Thank you very much, Collins, CEO, interim CEO, YIDP, and all the leaders of YIDP who have been for the last 2 days managing this convention very successfully. I come to you with a heavy 95 kilograms of gratitude and thanks for 2 successful days that you have actually taken lead in this convention. I have been in and out because of other office responsibilities, but my laptop has been on throughout the 2 days, and I have been in listening to whatever was happening, and I could hear a successful conversation all along happening. From what I can judge or gauge, this convention has drawn a global participation from South Africa, from East Africa, from West Africa, from the United States, from India, and all other parts of the world. So YIDP, congratulations. You have really managed to solicit global attendance in the first YIDP convention, that is a youth convention, which is really very important. You have also managed to draw experts and professionals from a wide area: health, education, the media, the ICT, community development experts, social and cultural experts. And the conversations that have taken place here over the past 2 days have been very, very rich. And my hope is, Collins, as you have been mentioning, that I believe, and I'm very aware that there have been recording here, some of the conversations that have taken place here, in fact, all of them are very critical, and they are really important even to inform policy. And I hope media personnel were present during these 2 days to capture some of these events. Again, I'm so delighted that this convention is being championed from Kenya. And as I mentioned yesterday, much more delighted that a number of the YIDP alumni who are actually leading this process are alumni of Tangaza University College, where I speak from now, and precisely alumni of the Center for Leadership and Management, giving us the indication that actually the Center for Leadership and Management is now mature enough to train world leaders. And what you have presented and posed has really made me proud of you. So I wouldn't like to take a lot of time in the interest of time, but I just would like to state that the Center for Leadership and Management at Tangaza University College has been very proud and delighted to be part of to be in partnership with YIDP in organizing this convention that has successfully ended over the 2 days period of time. My deep gratitude to all the keynote speakers in various topical issues and all the panel conversations that have taken place, the rich conversations that have taken place. Thank you to you for generously giving your time and offering your knowledge and your wisdom so that all of us could learn from your expertise. In future, when such a thing is called, I just call upon ourselves to be open and available so that we can continue to learn from one another to make our world a better place to live in, but also as we contribute towards realization of the SDGs that make our world a better place to live in as we move towards 2030, beyond that, 2063. Let us all be part of this journey. Congratulations, YIDP, congratulations, panelists, congratulations, keynote speakers, and congratulations, every participants from the global part of the world. Thank you very much. Asanteni sana. Over to you, Collins.
Thank you so much, sister, for closing remark. I am very delighted, and I'll not mention anything after that. So ladies and gentlemen, at this time, we are proud and we are very, very grateful for your time and for your contribution. So let's touch base as soon as possible. We'll get, like I said, we'll reach out to you as soon as possible, and we'll share the reports and the recordings with all the team who participated in this convention. May God bless you, and see you next time.
Thank you. Bye-bye.
Bye-bye, Doc.
Thank you. Great
Bye
job.
bye. Bye bye.
Thank you.
You're
Thank
most
you.
welcome.
Thank you.
Nasema?
Thank you very much and goodbye.